Morning, everybody. If you could just give us a few minutes, just making sure everybody gets moved from the waiting room into the meeting itself.
Brent,
Yes, sir.
before you get started, I would just note that we are recording and we are streaming live on Facebook. All comments made on Facebook will not be directed towards the meeting because we can't manage multiple sites. So the Facebook Live was just for view only. If people would like access to the meeting, they will need to go to the Zoom link directly, but the Facebook Live is just for view only. You might want to say that again once you get started.
I will. Thank you.
So Sam, there's two people in the waiting room, Harry Ankers and Mike Larson. And one of them just got in, but Mike Larson, I keep clicking admit and it keeps cycling back to, I have to keep clicking admit for him, so.
We'll keep trying to admit it.
Yeah, I've disabled the waiting room, so there's nobody's coming in and then getting stuck in the waiting room, but he seems to be stuck in the waiting room.
Does that mean they'll admit directly into the meeting now, Jason?
Yes.
Okay, thank you.
Sam, I have no idea what to do with this individual. He seems to be stuck.
Why don't you turn the waiting room back on for just a second, then try and admit him, then turn it back off.
For those that are in our waiting, we're just letting the last couple in from the waiting room just to make sure they can get in. We've got one person that's kind of stuck in a queue. We're trying to get him out of there. And we'll get started.
We're giving them a phone call right now.
There's no one else in the waiting room, Brent.
Just that one.
Okay. And you're going to call him, Jason?
I've got someone giving him a call.
Okay. We'll get started in the meantime. Good morning, everybody, and thank you for attending today's emergency board meeting, August 23rd, 2021, regarding the vaccine mandate. For First off, we'll read our mission statement and then we'll do a roll call. It is the mission of Maine EMS to promote and provide for comprehensive and effective emergency medical services system to ensure optimum patient care with standards for all providers. All members of this board committee should strive to promote the core values of excellence, support, collaboration, and integrity. In serving on this board and committee, we commit to serve the respective providers, communities, and residents of the jurisdictions that we represent. For roll call, ad hoc members, Dr. Kate Zimmerman.
Present.
Dr. Matt Scholl. Dr. Scholl. Nate Allen.
Present.
And also, if you could just indicate your representing group on the board, if you could, for me, please.
Nate Allen, Region 5.
Thank you, Nate. Tim Beal,
Present, Region 3.
Brad Chaquan,
Present, municipal provider rep.
Joe Conley,
Present, for-profit rep.
Heidi Cody.
I see
Ready?
her, but she looks like she can't unmute.
Okay, we'll swing back, but I do see her. Laura Downing.
Present, EMD rep.
Thank you, Laura. Amy Drinkwater,
Present, Region 6 rep.
morning, Amy. Judy Garish.
Judy present, public rep.
Thank you, Judy. Joe Kellner,
Good morning, I'm here, Region 4 rep.
Rich Kinnelet,
Good morning, Chair. Southern Maine rep.
morning, Rich. I'm Brent Libby. I'm the municipal fire chief rep. Dr. John Martell. Don't see Dr. Martell. We'll swing back. Julie Ontango. Don't see Julie. Dennis Russell.
Present, not for profit rep.
Morning, Dennis. Thank you.
Hey,
Steve
Ju-
Smith.
Julian
Okay.
Tango sent me a message that she is here, but she's called in with a phone number and she can't unmute. And
Okay.
Matt Scholl just let me know he's here too.
Okay.
And John Martell is here, but cannot unmute.
And I am here, present, Region 2 rep.
Thank you, Steve. And Scott Susie.
Got it, sorry. Good morning, Scott Susie, Maine Fire Chiefs rep.
Good morning. All are present and we have a quorum. Also joining us this morning is Commissioner Mike Soschuk, who we will branch off to in just a moment. And we are expecting Dr. Shah a little bit later, approximately around 9:30 as well. Any disclosures of any conflicts from the board? Seeing none. I'd like to take a quick moment and turn over to Rick Petrie and then to Tim Beals, who would just like to recognize two former members of our state EMS system that have recently passed away. Rick?
We have to go through and ask him to unmute. He should be good to go now.
Okay, thank you.
Thank you, Chief Libby. I just had to get unmuted there. Would like to take just a moment of the board's time to recognize the passing of Carrie McKee. Many of you know her as Carrie Pomelo. After a long battle with cancer, Carrie was a longtime member of the Maine EMS system who worked not only as a paramedic and a provider, but as an educator, mentoring hundreds of current Maine EMS providers. Her contributions to the Maine EMS system will be felt for generations. Thank you.
Thank you, Rick. Tim?
Yes, thank you, Chairman Libby. I too would like to recognize Dan Palladino. Dan recently passed away with a relatively short battle with cancer. Dan was a longtime educator here in Maine, a paramedic with Delta, and has touched many people throughout his career here in Maine. So two great individuals that we lost in the last 2 weeks. Thank you.
Thank you, Tim. If we could just take a brief moment of silence to remember those two and all others that we've lost over the year. Thank you. A couple of things for the meeting today. We certainly have a large attendance with us. The intent of the meeting is to offer some public comment, but also for the board to discuss the recent mandate passed down by CDC, of which we do not have specific purview or control over. So the board's intent today is to hear public comment from those providers and organizations that this affects. And the board has a couple of options. You may have seen the draft rule that we had our AAG put together for us to be able to work off and pick apart if the board so chooses to go that route. The board could pass its own emergency rule today. The board could pass a resolution regarding vaccines, or the board could simply acknowledge that the CDC rule has been passed and leave it at that. So a couple of options, but unfortunately, there's not anything specific that we can do with the CDC rule, and certainly would encourage those that relay their comments to us today to pass those comments along to the CDC as well for their rulemaking process, as theirs runs similar to ours. When we get to the public comment period, and I'll bring this up again, we will ask you to raise your virtual hand at that time, and we'll call on you. We'll ask you to identify yourself and what organization you're representing. And we'll do our best to try and keep comments to a 3-minute time frame so that we can try and hear from everybody that wishes to speak. The board has received well over a dozen, probably close to 24 letters and emails, which we very much appreciate. And continue to receive those and go through them. This meeting is recorded and it is also streaming on Facebook Live. The Facebook Live is not a venue that we can accept comments on, so the comments are turned off there because we're not able to manage both. So if somebody does wish to comment or speak, they will need to use the Zoom link and come into the Zoom meeting to do that. With that, I'll turn it over to Commissioner Sawchuk for some opening comments and some background. Commissioner?
Yeah, good morning, Chief. Thank you very much for the opportunity to chat for just a couple minutes. Good to see everybody in this setting or otherwise. So I just wanted to kind of get in on the front end of this and chat about a couple of things. First, I wanted to say and acknowledge the memorial for the two of our EMS providers that we lost here recently. And my heart goes out to all of you as fellow family members, and certainly their families and their communities. A big deal to all of us whenever we lose any of our close family members, team members. I want to say thanks to all the providers that are on the call today for all the work that you do day in and day out on behalf of your community, as well as your AMS and EMD professionals to the left and right day in and day out. And I also want to thank the Maine EMS boards Today it's a dynamic conversation. A lot of folks are very passionate about it. This is a conversation you didn't start, but here you are to step up and do your jobs and take a look at this issue and make a determination as a board how you want to proceed. But whether it's this issue or something else, you all have very busy lives on the professional side, on the personal side, and you give of yourself to take part in these processes on a regular basis. So as administration, and certainly me as the Commissioner of Public Safety, certainly do appreciate all of your input and the work that you do on our behalf. To kind of go back to last week's meeting a little bit, what I got to do, I'm just going to own this, that, as a state, that was an epic fail on our part. We were under the impression we had a license for 500. We were told that a couple different times. A license of 500 wouldn't work today, which is why we have a license for 1,000. So last week, we thought we were good to go. Really, Maine EMS has been a major assistance to me since we went virtual. Jason and Sam have facilitated upwards of 50 of my statewide law enforcement calls because they were doing Zoom long before Zoom was cool, right? So in that instance, we know what happened. We had 200 instead of 500 at the time. And the decision was made to postpone the meeting. And I just want to say, I apologize for all of that, jumping through hoops. Again, this is a dynamic issue that people are passionate about, and delay it 6 days just compounds things, right? It's just, we don't have answers. We're not really sure what's going on. People continue to get more and more riled up because they want an opportunity to give public comment on something that's important to them. So I apologize for that as the Commissioner of Public Safety. That's completely on me. And our staff did the best they can to facilitate that. I also would say that I think the board's decision to postpone it today makes perfect sense. It was absolutely the right call. You could have had one meeting and then had another one or whatever. But this time, everybody has the opportunity to hear the same message from their coworkers, their peers, their constituents in many cases. And I think that's important. It's also important to realize, as Chief Libby had mentioned, is that I think we had those 6 days because this process with the Maine EMS board does not have an immediate impact on the DHHS CDC rule, right? I mean, it's not, if we're not in tomorrow, Wednesday or Thursday last week, the whole thing is going to go sideways. The reality is that this is two separate and distinct processes here. And I want you to think about that. And I acknowledge that because the board made the right decision there. I appreciate that there as well. To talk about the mandate a little bit, which is of course why we're here. I think that this administration, DHHS, CDC, DPS, all the acronyms, certainly Maine EMS have been very, very supportive of vaccination since the very beginning. Should be no surprise there. You probably heard 100 PSAs this weekend alone. And so while I have zero issue with taking care of our folks and making sure that our people are safe as they can be, as healthy as they can be for themselves, as well as those they serve. What I wish we could go back and do is have more time about that rollout, right? The surprise, I think, was as much of an issue as the underlying change itself. I don't think there's any question about that. I would say, as a reminder, though, that that's an emergency rule. The decision that was made within about 48 hours, it came in and hit. There was some drafts going on and they pushed it out. They pushed it out, and Dr. Shah can speak to this in 5 minutes or so. But the reality is that the emergent nature of the Delta variant nationally and certainly in our own backyard and the surge in those kind of cases, 2 outbreaks in healthcare settings and hospitals were the impetus to create an emergency rule. And I think that we worked incredibly hard throughout this pandemic to be as available and accessible as we can be. And I know Sam has had 1 million EMS meetings. We've been to union meetings, early, late, weekends, it doesn't matter. If people want to talk to us, we've gone out to do that because we know that we work with you, we work for you. And so we want to be responsive in that way. So traditionally, if we had time, we would reach out, we'd have some meetings, we try to get some buy-in, we talk about things, we get public comment, we'd use all that information to make decisions. When you have an emergency rule that was implemented in this case by DHHS, CDC, we didn't have those opportunities. And I apologize for that. I wish that we did. Of course, things would always be smoother if we had a chance to sit around, even if we got feedback and disagreed with the outcome. That's fine too in my world, right? We're not going to make everybody happy business. We accomplish the mission and we try to make as many people happy along the way as possible. And that's working with our partners, working with the people that we enjoy being around, which in this case is our EMS team, our EMD folks, that entire world. But we didn't get a chance to do that. So what I would say is that I'm not surprised that the mandate came out the way that it did for now. And as Chief Libby had mentioned, that was an emergency rule, which means they have 90 days, which is probably closer to 80 now, to make changes, to go through a rulemaking process. So there is an opportunity to change that rule. People are, in fact, paying attention. They are interested in public comment. They do want your feedback. That's not just the Maine EMS board, but that's Maine CDC. That's Dr. Shah. That's the governor. That is Commissioner Lambrew from DHHS. That's certainly me here at DPS. I think that our messaging has been very consistent when we've talked to you since day one of this pandemic. I can tell you that Sam has been a true champion of this industry and constantly pushing, constantly out front, fighting to say that our emergency medical services personnel are in fact healthcare workers. They are an imperative. They are a priority here. I've been fighting nonstop for those things, as well as EMD, to say our dispatchers, our telecommunicators, our first responders. If the front end of our system is broken, the back end of our system will not be effective. And we've made those arguments about masking, about testing, about COVID-19 notifications, about 100 different things throughout this pandemic. So I'm not surprised to see somebody put EMS into the public healthcare worker category. We've been fighting for that. As a matter of fact, a lot of people on this call demanded that we make that fight, and we've made that fight. And now that designation has been made in this particular scenario. And I understand that masking is different than vaccines. There's no question about it. But when we've made those arguments to say, you are important to us, you matter to us, your health matters to us, so that you can take care of our loved ones. We've been making those arguments for 18 months. They've listened to the extent that now there's been a mandated vaccine. Now we can discuss whether or not you want to go to that extent or not. And we've received feedback on both ends of that. But I want you to know that we've been making this argument since the beginning. And many of you have asked us to make that argument. And we made it, and somebody listened and they put us in that category, and now there's an issue with it. So we need to take a look at those things. We want to hear from you. And more importantly, I want you to know that we are in fact listening, and there is an opportunity to have an impact here. So I'll just wrap it up with that. You got a long day ahead of you. My intent is to be here throughout because I'm interested to hear what you have to say. If I get your internet connection is weak, I may pop off the camera for a minute. We got a lot of people on here, so but the intent is to be with you all day and to listen to that public comment because it's important, and we do in fact care about that. So I want to say thanks to Director Hurley and his team. I know you're going to do this. You've done this already, but this is not a personal deal. It shouldn't be personal tax levied at anybody. This is a professional decision, and everybody will be respectful of everybody's roles throughout. Just like you always are. And we certainly appreciate that. So to Sam and his entire team that works so hard on our behalf, the EMS board and all the providers, no matter how this goes or what you think on this issue one level or another, what you're always going to get out of me is a handshake and a smile, whether we can agree to disagree or we're lockstep together moving forward. That's what's going to happen. Again, we'll see where this ends up today and at the end of the rulemaking process. But I do appreciate you being here. Very strong turnout. 657 is amazing. That's outstanding. And that means you're invested in your work, in your calling. And we wouldn't expect anything less. So Chief Libby, thanks again for just a couple minutes. I truly do appreciate that, and here to help in any way I can. As a non-expert in the matter, but happy to chat it up. So thank you, Brent.
Thank you, sir. Sam, any housekeeping items, or have you seen Dr. Shah join as yet?
Dr. Shah is in the process of joining right now.
Okay.
Brent, we have had several people join the Facebook Live. If you just want to make a small reminder while we're waiting.
I will, sir. So folks, we are recording this meeting and it is running live on Facebook Live. The comments on Facebook Live are turned off because we're not able to manage both and we can't have two separate meetings. So the intent there is that you're still able to watch, but if you wish to comment or participate, you'll need to log into the new Zoom link. There is a new Zoom link from the posting for the 23rd meeting. I know I've gotten a couple messages from people that have looked for the 17th meeting. So there is a new link for this meeting today. So if you do wish to provide comment, you'll need to log into that Zoom to be able to do that.
And Dr. Shaw is here.
Good morning, Dr. Shaw.
Good morning. Good morning, everyone. My apologies for being a bit late. Just huddling with my staff at our standing meeting. So thank you all for inviting me to join. I'm delighted to be able to be with you.
Thank you, Dr. Shaw. We're getting ready to get into a public comment, but just wanted to just give you an opportunity to maybe provide a little bit of background or anything on the mandate that we're discussing today before we get started.
Sure, and thank you for giving me a couple minutes. Not having had the privilege of hearing what Director Hurley and Commissioner Sawchuk may have mentioned, I run the risk of being a bit repetitive, so I'll apologize in advance for that. But we do appreciate your time and your continued partnership. EMS clinicians have demonstrated throughout the course of the pandemic that they are the finest partners that we have as we battle COVID, not just serving as first responders, which they undoubtedly are, but also as a core piece of the healthcare community as healthcare providers. That is among the reasons why we felt it was indicated and worthwhile to include them as part of the broader work around ensuring that our healthcare workforce is fully vaccinated. In my mind, there are, generally speaking, three reasons why we do so. The first is to protect them as first responders and healthcare providers. The second is to protect those whom they are serving in the field. And then the third is to protect the force overall. Now, I know that there are some open questions and certainly there are concerns. And we're happy to have those discussions as we move through the emergency phase and then as we plan for the more permanent phase of the rule in roundabout 80 days or so. So this is the beginning of that conversation, not the last part of that conversation. But as we now see things like full approval of the Pfizer vaccine on the horizon, perhaps as soon as today, as well as continued outbreaks among healthcare workers in Maine, as well as nationwide, we see continued reason as well as continuing support for ensuring that the broader healthcare workforce is fully protected to keep that force strong. So again, I very much appreciate the partnership that we've had with you, and we look forward to working with you going forward. But with that, I will pause and turn things back over to you.
Thank you, sir. We will get into public comment. As I said, we'll ask that you raise your virtual hand and we will unmute you as we go. We're going to try and limit comments to 3 minutes. If you could identify yourself, the service that you represent, and also if you could indicate if you're in favor or opposed or kind of have an opinion either way as far as the mandate goes. So Jason, do you want to take them one at a time or do you want me to do that?
If I can help folks unmute in the order that they raise their hand.
Okay. So I would say the first appears to be Larissa Crockett.
Good morning. Can you hear me?
Yes, I can. Thank you.
All right. Thank you for letting me speak. So I'm the town manager of the town of Wells, Maine, and would like to say that the town of Wells, first off, is really very proud of its staff for working through this pandemic. Our first responders have never taken a day off. They did not have the privilege of staying home when so many of our office workers were allowed to do so in these early days and even for the first few months. So first off, just want to say thank you to all of the people in public safety for all of the hard work that they've done to be working and keeping us safe. The town of Wells is not in favor of this mandate. We are thankful and pleased for the number of staff that have chosen to vaccinate. When we look at our public safety team, We have about 8/9 of our staff is fully vaccinated, and we're grateful to them for that effort. For those few remaining that have not chosen to vaccinate, we respect their decision, and we also feel that because our workforce is so heavily vaccinated, they do not necessarily pose the same level of risk to their fellow workers as perhaps they may have in a less vaccinated operation. So we would ask for, if the vaccine mandate needs to stand, that we at least be given the option to allow people to exempt themselves with either testing protocols or other mechanisms so that they are not forced to vaccinate against their will. Thank you.
Thank you, Ms. Crockett. Appreciate it.
Next up is Chris's iPhone.
Hi there. Thank you for the opportunity. My name is Chris Clark. I'm representing myself. I work for AMS Ambulance, but representing myself, not speaking on behalf of the company. My company has done a great job of staying neutral. In this whole situation, we have some great providers. There's no doubt this COVID pandemic has been hard on all providers and all services alike. I personally took the vaccine out of personal choice. I'm here today because I believe in personal choice. I believe that folks should have the right to choose whether or not they want to be vaccinated. I do have a couple of questions that I would like answered. I will say I am against the mandate, as you asked us to state. I am against the mandate. I think that the mandate goes against personal choice, and we should allow our providers to make that choice since we're educated health officials and we understand the risks that are associated with any COVID. My questions are this. Number one, we had providers at Maine Med that were vaccinated that contracted COVID. And so my question would be, why the vaccine mandate when we can still get COVID? The other question is, I've heard a lot of rumors that those folks that are vaccinated, the Delta variant is not showing symptoms in them as soon as those that are unvaccinated. So wouldn't we be more likely if we're vaccinated to transmit to our patients because we don't know that we have COVID? So those are my two questions. And again, I believe in personal choice, and I think that Maine EMS should allow their EMS providers to continue to have personal choice. Thank you very much.
Thank you, Chris. And we'll take questions down as people have them, but unfortunately we won't do a back and forth to answer those questions because I think we would probably be here till Friday. But if people do have specific questions, we'll take those down and we'll work to address those during our deliberations a little bit later on. Next one should be James Jarvis.
Dr. Jarvis, yep.
Good morning, and thank you for allowing me to address this forum. I am Dr. James Jarvis, a family physician and the lead clinician for Northern Light Health COVID Incident Command. I'm speaking in support of the requirement for vaccination against COVID-19 for all individuals who play a role in medical care within our communities. COVID-19 continues to spread at an alarming rate across the United States. Here in Maine, we have seen a steady rise in overall cases of COVID-19, particularly over the last 2 weeks. This has resulted in increased number of visits to our emergency departments and admissions into our hospitals. In the United States, some 40,000 plus individuals are now hospitalized due to COVID-19, with nearly 2,000 of those being children under the age of 18. Northern Light Health's positivity rate, or the percentage of tests that are positive, now stands at near 8% over the last 7 days and over 7% of the last 14. In comparison, the state positivity rate was less than 0.5% at the start of last year's school year, and less than 2% just prior to the November and December surge in hospitalizations across our state. Our emergency responders play a critical role in the infrastructure needed to provide rapid and seamless care of our most vulnerable and acutely affected family, neighbors, and community members. Keeping these vital individuals safe and healthy is not only necessary for their well-being, but for the well-being of Mainers everywhere. While Maine has done an incredible job in both managing the pandemic and keeping its healthcare workers and first responders safe, it is clear that the Delta variant has made this a much more difficult task, as is evident by the stories we hear in other parts of the country. Specifically, 911 calls going unheeded as EMS staff are either overwhelmed or they themselves are sickened by the disease. Many of us are aware of the challenges we have had locally when personnel needed to be quarantined due to exposure or infection. Adequate PPE, maintenance of physical distancing, and good hand hygiene are still the mainstay of preventative measures. However, with increased transmissibility of the Delta variant, they too often fall short of protecting all involved. Vaccination confers a level of protection that surpasses each of those measures. The vaccines currently offered in the United States are not only extremely effective, but exceptionally safe. The current vaccines have been shown to decrease the severity of illness, the rate of hospitalizations, and death from COVID-19. In addition, they also decrease the transmissibility of the virus from one individual to another. The rate of breakthrough infections is exceedingly low and is lower than expected based on the initial data of the performance of the vaccines. This shows that the vaccines work and that all eligible individuals should be encouraged to be vaccinated. In addition to the protection that the current vaccines offer, their safety profile and the data supporting that is greater than many other vaccines currently routinely administered to protect us against many other diseases. To date, in the United States, nearly 350 million doses of vaccine have been administered, representing nearly 170 million different people. Worldwide, 4.7 billion doses of vaccine have been administered. Here in Maine, Northern Light Health has administered 287,000 doses alone. While there have been side effects, most are mild and self-limited. The very few reports of complications after the vaccine occur at a rate so low, the benefit of the vaccines is far greater than the risk. In fact, the risk is far lower than some medications that are available over the counter and are taken routinely for conditions far less serious than COVID-19. With the spread of this virus and its consequences increasing each day, and predictive models forecasting the trend will continue at least for weeks, if not months, it is imperative that we do everything possible to protect our most vulnerable and neediest population. This includes ensuring that we prevent any spread of the disease from any member of the healthcare team to the individuals for which they care. In addition, we must ensure that we protect our healthcare workforce so that we are able to continue that care. Vaccination is the single best way to accomplish both. Our communities need from us a firm commitment to zero harm and our continued availability when they are in need. Northern Light Health fully supports the requirement of vaccination against COVID-19 for all healthcare workers, including those in emergency response services. Thank you for your time, and I welcome any questions the board may have.
Thank you, Dr. Jarvis. One other point of in people's comments, if they could also note, one of our biggest issues today is how we as a board will respond to the mandate. As mentioned, the mandate is what it is for this current moment, but also we will be debating how we will respond to that if people have input on that as well. Next up will be Troy Kaye, please.
Good morning, Troy Kyrie, Sabatis Fire Department here. I'll start off with, I do not support the mandate. My question, because I figure we're doing questions, not statements here. What is going to be repercussions for organizations that do not elect to terminate or fire individuals if they do not follow through with the vaccination requirements? And then second part to that question, if we have to terminate good individuals that we want to keep around on our organizations, will we now be able to ask patients when we respond to calls for their vaccination records? If they cannot provide it, are we able to refuse treatment to them?
Thank you, Troy. Next up should be Shayna Weber, please.
Hi, I am coming to you guys. Can you hear me okay?
Yes, thank you.
Okay. I'm coming in as a public advocate for my rural community in Garland, Maine, but I also am the wife of a paramedic who serves in the Old Town region. And I originally had a question, but then when I heard Dr. Shah speak, I simply have one question. You state 3 reasons why you included Maine EMS in this decision, not really decision, mandate. And you state that number 1 was to protect the patient, number 2 was to protect themselves, and number 3 was to protect the service in which that they were a part of. My question is, you've stated these 3 things. Would it not be unreasonable to compromise and meet in the middle to save the future of the healthcare system for emergency providers by compromising and allowing for proper PPE and testing weekly for those individuals who choose not to vaccinate. Not only are we allowing for them to keep their freedoms, which is constitutional, but we are also allowing for those individuals to protect their patients, themselves, and protect the communities in which they serve. I don't think that's unreasonable. I think that should certainly be discussed in when you guys get together. I personally am opposed to the vaccination. I think that it trumps the rights of citizens, but I don't think that that would be an unreasonable alternative, and I think that should be considered, and that would be my only input on this situation. Thank you.
Thank you, Ms. Weber. Mr. Benatti.
Thank you, Chief. I'll be as brief as I can. I am Steve Benatti. I'm the fire chief for the city of Sanford, and I speak for the city of Sanford Fire Department and Fire Department alone. First off, I want you to know that I believe in vaccinations. I believe it is a good thing for this country, but I'm against this mandate. We have attacked a specific group who are suffering burnout within the state because of the COVID. This is a group that has suffered from staffing all along and will continue for a long time to come. I have not seen the data that shows that EMS is a problem with the spread of the virus. The crippling effect this will have on our emergency dispatch centers is yet to be seen, but will be paramount when somebody tries to dial 911 and nobody answers, or their call for help is delayed as a result. The loss of first responders is yet to be realized. Sanford specifically is at a 10% deficit due to regular outages at this time, and this may push it to 18%. That has a detrimental effect on the city of Sanford and its payroll, as well as the ability to handle calls. Over 170 fire departments in the state of Maine are responsible for EMS in their communities. And yet the state of Maine did not bring the fire departments into the discussion when this came about. We are not as same as the state of Maine, we are not the same as Maine Health, nor do we want to be. Our job is extremely important, but different. We had no rep at the table to discuss how this was done, and Sam Hurley does not represent all the organizations nor the fire departments within the state of Maine. I would ask for an alternative to be considered, like regular testing and masking, instead of mandates of vaccine. And I also have the question, will an EMS provider license be tied to the vaccination policy? So should people refuse the vaccination, will they lose their provider license? I ask that clear heads prevail here and look at all sides of the coin and the devastating effect that this mandate may have on the overall ability for Maine EMS organizations to provide emergency medical service to the state, including our dispatch centers, which those two are struggling to keep a number of people in their seats to handle the 911 calls. Thank you.
Thank you, Chief. Next up is iPhone.
Good morning. Can you hear me?
I can, yes.
Hey, good morning. My name is Fire Chief Tom Chisholm with the Southwest Harbor Fire Department. And I just want to formally say that I'm opposed to this mandate. In the county of Hancock, we have one of the strongest, if not the largest, retention of call firefighters or volunteers, currently having over 30 members in an active junior fire program. We hold a first responder license. Our department is at an 81% increase in call volume. We already exceeded our year-end total of last year several weeks ago. My fear is the increase of that is due to call out of EMS assistance due to the shortage of EMS providers and services in our town. And my fear is that not only will I lose a third of my department because of the vaccination or vaccine mandate, but I will lose the rest of it because they're not going to be part of a failing entity anymore. So on behalf of the fire department only of the town of Southwest Harbor, I think it would be detrimental to one of the towns nestled in the top 10 tourist destination in the United States. Thank you.
Thank you, Chief. Kyle Baker, please.
Good morning. My name is Kyle Baker. I am the QI officer at Winthrop Ambulance and a lieutenant full-time with Medcare Ambulance. I am neither for nor opposed to the mandate because I understand the reasons for and the reasons against. My biggest concern right now is exactly what some other speakers have already articulated. The strain on existing personnel will worsen should this mandate proceed. Most of us are already working 80, 90, 100-hour work weeks across, some of us across multiple agencies. And there are people who are willing to walk away if they're mandated to receive a vaccine that they don't want. And that puts a tremendous strain on those of us who remain, who are already working as much as we possibly can in less than ideal conditions, which we have been right along. Those conditions will worsen. And I would advise caution to the board as they consider allowing this mandate to stand for that reason alone. We're already struggling, and this is going to make that worse. However, I understand the desire to have everyone as protected as possible. I would urge the board to consider that there are other ways to accomplish that. Thank you for your time today.
Thank you, Kyle. Danny is next.
Yes, good morning. I'm Danny. I work for two different departments in the Lakes Region area. I'm an advanced EMT. I'm very much against the mandate, only because how am I supposed to advocate for my patient if I can't even do that for myself? So my two questions, one has already been asked, it's very similar. How is this going to affect my license? And if it does affect my license, will I still be able to get my continuing education credits towards it so that I can still renew it? Thank you. And also, if you're not answering questions here, then when can we expect the answers to these questions?
We'll try and hash those questions out, Danny, when we deliberate as a board after the public comment period.
Okay, thank you.
Thank you. Amanda, you're up next.
Good morning. Can you hear me?
Yes.
It's Jeff Creation, Fire Chief from the town of Newport. We're all sitting around as a group. We didn't want to crash the system again, so we all gathered around. But thanks for taking our comment. And as most people have said, we're deeply opposed to the mandate. Most of us have been vaccinated, but we feel it's everybody's choice to do so, especially considering how all over the place this has been since the beginning. The things such as vaccines, if it's going to stop the Delta variant, as we understand it's not 100% going to stop it. So if it can't stop it, you're still going to be able to spread it. So if you're taking something you don't know what it's going to do to your body and you're still going to get it and spread it, why take it? So those are some questions we're having a hard time with. And just the overall fact, it's a broken record thing. Most everybody knows EMS and fire are at critical staffing levels throughout the state. And if this mandate goes through, a lot of people can't afford to lose any more people and still operate. Not to mention that there's a huge portion of the state that is still handled by volunteer call people part-time. And if you're not paying your bills, supporting your family with this career, and you're doing it as a love, and someone's going to force you to do something that you're deeply opposed to, I'm afraid we're going to lose a lot of people that we're never going to get back. So that's one, that's about all I have to add to the situation. Thanks.
Thank you, Chief. Lori Rice, you're next.
Can you hear me?
Yes, there you go.
All right, Lori Rice, I represent United Ambulance Service. While we support and encourage people to get vaccinated, we do not support mandating and making that a requirement. I think by threatening people's livelihoods to strong arm them into changing their minds and becoming vaccinated really is not the right thing to do. Right now, we are having students withdraw from our EMS programs because they don't want to be vaccinated. We have some employees who stand firmly on their resolve that you're taking away their freedom and their right to do what they want with their own bodies. So we probably will be losing some EMS providers as well. I do have a few questions in regards to how this mandate rolls out. Is our wheelchair van service included into this mandate? Is this only our EMS and our education departments that are going to be held to this? Because the news did report that if after October 1st, any of the EMS services have unvaccinated people working for them, that we would lose our ability to bill Maine Care and Medicare, which are primary payers for what we do. So that is one question. And my other question is, who's financially responsible for all of this testing, or lab work to show immunity for certain things? And I'm going in regards to having to do complete vaccination records. United employs 197 people, which will be a daunting task for me to, as their human resources and the person who has the rights to see medical records, to form a database and report on all vaccination status for all of our employees. So I have to say that I would have rather have seen a mandate that goes back to those who are unvaccinated must don N95 masks from the start to the end of their shift and not be able to take them off at work, leaving the vaccination as more of a personal choice for somebody.
Thank you, Lori. Jenny, Sheriff, you're next.
Good morning. Can you hear me?
Yes.
Thank you for letting me speak. I work for Delta Ambulance and Central Maine Healthcare. However, I of course represent only myself. I am overall pro-vaccination, however, anti-mandate. I think that this takes away the right of autonomy, which we preach to our patients all the time, to be your own advocate, be your own boss, and yet we cannot lead by example. And I will tell you that this mandate has put an extreme amount of stress on an already very burnt out system of employees. I get no less than one phone call every single day from one of my workplaces employees talking about how stressed out they are. What are they going to do if they take the shot and they get sick? They're out of work. Who pays for that? If they don't and they get fired or they have to find another line of work, what are they going to do? How are they going to feed their families? And I share their stress. I don't think it is fair to require a mandate. I would echo everybody else's opinion, except for Dr. Jarvis, apparently, and say that a fair alternative would be regular testing, surgical masks in stations, and N95s on every call, which is mostly what we do now anyway. I do have a clinical question about the Delta variant. This is being kind of shoved down our throats on the daily by the news and all of social media. My question would be, what is the testing for that? Is there a specific test? Because I feel like if there is, labs would be completely overrun and not be able to do much of anything else. So I'd love to learn more about that. Thank you for letting me speak.
Thank you, Jenny. Appreciate it. Paul Silva, you're next.
Good morning. Thanks for taking the comment. First of all, I'd like to say that adamantly opposed to the mandate. I think the game has changed several times, and you wanted a target of around 60% vaccination, and most places are hitting 80, which is above and beyond. To touch on Dr. Jarvis's comments about side effects, I'm one of the ones that have experienced side effects. So I'd have to say that I disagree that the side effects have to be weighed as little as they are or not. They're still unpleasant. Even though FDA approval for Pfizer is probably going to come this morning, I think you still have to look at the long-term effects that are still understudied. And then the other option or the other issue here is you have vaccinated and unvaccinated that are both carriers and transmitters. So the simple question is, what's the benefit of getting the vaccine? And the simple answer of a lessened case is not good enough for a lot of people. Personal choice, stripping that away is not very cool for the state. And I think the fallout is going to be interesting to see after that. And just to touch on one more point that Jarvis had, people are leaving EMS not because of COVID related issues. They're leaving because of overworked, underpaid, the job stressors and all that stuff. So to comment on calls going unanswered because of COVID is incorrect and invalid. And I'd just like to echo Chief Benatti's point that for myself, and I know many others, Hurley does not represent or speak for a lot of the Maine EMS providers. So I don't think the vast majority of us share his sentiment. So thank you for your time.
Thank you, Paul. Next up is MJD.
Can you hear me?
Yes.
Okay. My name's Michael Devoid. I work in Portland. I'm not speaking on behalf of the department, but for myself. Against the mandate, I just asked the board and anyone mandating this, is it's all said how safe these vaccines are, but just want to make you aware that a third of medications that get approval by the FDA on average get pulled within 4 years because of problems that aren't noticed within trials. Some are a couple months, some are like Zantac that was recently pulled was 38 years before it was pulled because of the side effects that they found later on. Do you feel comfortable forcing someone to take something to find out 10 to 15 years down the road is detrimental to people's health and you forced it upon them? No one has a crystal ball. No one can see how these drugs are going to help or hinder in the future. So my question is, and some others have already asked that, is who covers these problems later on when we find out 10, 15 years down the road that they're causing medical health problems or deaths? Is the state picking up my health care because they're forcing me to get this? Since OSHA has already been given employers the waiver that they don't have to cover them. We're all stuck in mass. Let people choose for themselves. You can still give it, you can still get it. What's the difference? Worldwide, with higher vaccine rates, much like Israel, they're showing these vaccines are about only 30 to 40% effective, with a great risk of side effects to the younger population and less help for COVID for that younger population. Sweden has a low vaccine rates and little to no mandates and in better shape than surrounding countries that had stricter ones. 90% of Maine deaths are over 60. I just ask you again, how will you feel when you find out that one or all these cause problems or deaths later on to be on your conscience? Thank you.
Thank you, Michael. Bill Tower, you're next.
Hello, Bill Tower here, Sanford Dispatch Director. I've sent a letter to the board. I think the board's had an opportunity to take a look at it. It's got a number of inputs from the various PSAPs throughout the state. Just talking for my center, and if you take a look at my letter, and I hope you all take the time to really look at it and look at what the impacts will be. I am supposed to be staffed at 20 dispatchers. I'm currently staffed at 17. One of those is a trainee. I have 6 personnel who are not vaccinated who dispatch for me, some of them with more than 20 years of dispatch experience. I personally am vaccinated, so I have no issues with the vaccine. My issue is that the state is going to put all of the PSAPs in a serious predicament and that I will have, if this mandate stays the way it is, I will have probably 10 dispatchers to man a minimum of 5 chairs in my dispatch center 24/7. Do the math on that for me, because I can't make it work. That means I will probably have to either not EMD and be in violation at that point with state 911, or I will have to abdicate my dispatching capabilities for some of my contracted towns, at which point I'm still in trouble. So either way, I'm in serious trouble as a PSAP in the state. And my PSAP, as you all know, all the PSAPs are interconnected. If my PSAP fails to answer 911, it's going to roll to Joanne Fisk's PSAP. And if she can't answer it, it's going to roll to York. And what I fear is that we will now have to start installing in all our PSAPs throughout the state a call queue so that we can see how many minutes the 911 queue is up for. That is not something I look forward to. Thank you.
Thank you, Mr. Tower. P. Selberg, you're up next.
Good morning, Chief. Thank you very much. My name is Phil Selberg. I'm a Deputy Fire Chief for the City of South Portland. I'm speaking on my own behalf. I've been a licensed paramedic in the state of Maine since 2002. And since 2002, I've been called an ambulance driver more times than I would like to say. As a professional EMS provider, I believe in the effectiveness of the COVID-19 vaccines. I have received the vaccine myself. I am in support of this mandate to ensure that the EMS profession continues to be allowed to serve our patients to the best of our absolute capacity. This is about being part of a bigger team, and the onus is on us to ensure that our team is able to do exactly what it is we have all sworn to do. I would urge the board to speak in favor of continuing to advocate for this as a professional health service, which it is, and to go along with the guidance of the Maine CDC and allow this vaccine mandate to stand. Thank you.
Thank you, Chief. Michael Barker, you're next.
Hello, can you hear me?
Yes, sir. Go ahead.
Okay, my name is Michael Barker, Chief North Berwick Rescue. While we are in support of the vaccine mandate, a lot of the things that were already said, I echo. The system is already overwhelmed, as was discussed, and this is only going to stretch the system even further. I'm set to lose 10 to 20% of my workforce, and being close to the border of New Hampshire, where we share people that also work in that state, they will be opting to give up their Maine license and just work for New Hampshire services where there is no mandate right now. I think there are better options to be able to go forward with, and it's been talked about routine testing and masking around the country and in some of the bigger metropolitan areas that have come out with these mandates. There have been other options than getting the vaccine. The city of Boston being one of them. I really think that we need to take a look at what this is going to do to the entire EMS system statewide. We're going to lose people, and we're at a point where we can't afford to lose people. So, opposed mandate, not anti-vaccine. We have, made every availability to our people to get the vaccine. That's helped with the rollout of the vaccine, but the mandate goes against the personal choice, and we're going to lose good providers. And we also rely on our fire department counterparts to assist us on calls, and we're not going to get that assistance further burdening the entire system with mutual aid and things like that. So again, against the mandate, and I think other things need to be looked at. Thank you.
Thank you, sir. Kluge Jane, you're up next.
Hi, can you hear me?
Yes, I can.
Okay.
I am speaking on my behalf. I work for North Star Ambulance. I am against the mandate and I am also vaccinated. So Maine has been boasting that 80% of vaccinated people in Maine, we've already accomplished that. And so 70 was supposed to be herd immunity. So I'm trying to understand, if we're at 80 and 70 was herd immunity, why the force? To reiterate what everyone has said, vaccinated versus non-vaccinated, you can still get COVID, you can still transmit COVID. As far as the hospital mandates around the state of Maine, I understand that they have the right to do that, but making it so that medical people had nowhere else to go was the ultimate backing into the corner. I know people who had a plan B to go to non-hospital services to work, such as AMS, Medcare, and then it was forced, they just got backed right into a corner. In 2020, if we were notified that we were around a COVID positive patient, CDC would ask us if we had on proper PPE. And if we did, it was a non-concern. What has changed? So, and what about people who have had COVID and the antibodies? Does that mean anything? I know that people say that it's unknown how long they last, but yet we're talking about boosters already. People are devastated. People are losing sleep. They're scared. And one might think, just go get the vaccine. But these people have reasons. They have deep convictions, and you cannot force that. So we will have a shortage, and it will affect those still working. You know, these are our family members. I know where I work, half of the paramedics are walking away, and I'm proud of them for standing their ground. Those who are pro-mandate, where do you suggest we're going to fill those holes? Are people willing to come work per diem at other places to help fill those after this exodus? And what about the second wave of EMS people walking? When people are forced to do more with less resources and the burnout occurs, it's just something to think about. And that's all I got to say. Thank you.
Thank you very much. Eric Strout, please.
Good morning, Chief Eric Stroud. I represent the town of Levant Fire Rescue. I will come out and say I'm against the mandate. I didn't realize that EMS would come to a day of doom and gloom. I got into EMS years ago. I loved it. I think all of us would share that those that are involved in it, we do it for the right reason. The state of Maine, we've been known, we take pride in what we do. We love what we do. We take care of our patients. As a fire chief, looking at some more facts and opinions, I have firefighters that joined the fire department to be firefighters. We've never asked them to provide anything but a hepatitis declination or proof of hepatitis. I stand to lose many of my members now that are being forced to show proof of something else that they never really signed up for. Their hearts are in it. They want to be firefighters, but because I carry an EMS license, I stand to probably lose them. I think I'm only going to echo what a lot of the peers have said. My fear is mental health in the state of Maine for our providers is got to be number one. We have people that are vaccinated, which is amazing. They can't pick up the pieces when we have people walk. I lost a loved one who was on my department to suicide. It was burnout. I lost a brother. I swore I would never see somebody else get into a position where mental health was going to go against that. I'm scared for my department, but those around me, that we're going to lose some other good people. They're being make a choice of, if you don't like it, quit, go somewhere else. There's nowhere to go. These are people that have put their lives on the line. They're professionals. As volunteers, I call my professionals all the time, but they're made to make a choice that I think we're going to see a burnout that we've never experienced. What was just echoed, what's our contingency plan in Maine EMS? How do we pick up those pieces when we see people walk? Or the mental health crisis, we know it's there, and we can't stand to lose anybody. That's got to make that choice. In closing, I thank you, Brent, for leading this, and the rest of the group. You have a challenge against you, and thanks for all you do to represent all of us.
Thank you, Chief. Cody Fenderson, you're up next.
Hi, Chief. Thank you for your time. Cody Fenderson, Deputy Fire Chief for Fairfield Fire Rescue. I think most of my counterparts have already touched on the big issues that everyone feels with this mandate. Here at Fort Fairfield, we support vaccines, but we do not support the mandate. Basically, the bottom line is we're a combination career paid call department. I have 24 members currently. October 1st, I lose 1/3 of those members. Out of my remaining members, I have 8 members that are not full-time with another fire EMS service. Of those 8, 2 of them are on long-term medical leave. Of those 6 remaining, 1 of them is myself. Of those 5 remaining, 1 of them received the first shot of the COVID vaccine and suffered a severe allergic reaction to it and cannot get a second one. This is going to severely cripple my service as well as many of the other services in our area. And as some of you may know, our department was formed during the pandemic because we needed ambulance coverage. And as the physician from Northern Light mentioned, we're at critical staffing, and keeping this mandate is gonna make calls go unanswered, not the other way around. Thank you for your time.
Thank you, Chief. Mr. Stephen Buck, please.
Yes, thank you. Can you hear me?
Yes, sir. Go ahead.
I'm opposed to the unilaterally implemented emergency rule until such time as they address the concerns that are being heard here today. I support being vaccinated and the well-intended emergency rulemaking by DHHS. Also, I fully appreciate the weight of responsibility placed upon DHHS and CDC and now the EMS as it pertains to responding to the COVID-19 pandemic. That said, we must recognize that it was made in a very rapid manner in an attempt to mitigate the impacts from the Delta variant, absent public input until this point. We must also recognize the unintended consequences that have not yet been fully planned for. There are difficulties mandating the vaccine that is not fully approved by the FDA, that is outside the realm of normally accepted standards. I would seek consideration of alternative safety protocol and an interim step such as masking and PPE, testing requirements, and also ask you to consider some of the largest impacts we have seen from the pandemic are those that we did not adapt to and mitigate along the way in dealing with COVID-19, that being economic, mental health, workforce adaptation, and workforce preservation. It is the last element that concerns me the most, workforce preservation. At a time of extreme shortages in EMS and dispatch services, what might seem a small number of losses and it also as being insignificant, the fact of the matter is we as a state, by implementation of this emergency rule, we have not yet accounted for the realities stemming from any losses within our EMS or dispatch services. I request the EMS board work with the CDC and DHHS to mitigate the potential loss of providers by setting standards for use of PPE and testing until such time as the vaccine has been fully approved by the FDA and more uniform approach can be implemented as per prior medical and vaccination standards under normally accepted standards. Thank you.
Thank you, sir. Dana is up next.
Good morning. Can you hear me?
Yes, sir. Go ahead.
Thank you for taking a moment for public comments. A comment and a concern, a question, I guess. So we went through 2020 and most of 2021 with full PPE for all PUI calls. And now all of a sudden, you're asking us to do both the vaccine and the PPE. And I guess we made it through a year and a half, almost 2 years with PPE. And now all of a sudden the vaccine is the end all be all. And I'm a little concerned. We promote vaccination here in Harrison. I am the chief of Harrison Fire Rescue. We are not in favor of mandatory vaccines. We think it was rolled out a little too quickly and a little too haphazardly. And that is our concern. I do have a question. I run a first responder service. We have 7 members. I have 26 non-licensed members of the fire department. How do I handle this? Are they no longer going to be able to come out on car accidents where there's injuries? Are they no longer going to be able to go on CO calls where there's injuries? Are they no longer going to be able to come out and assist us on lift assists? I think there's a lot of these fire departments out there that come out and help us, both the fire department that has EMS and the private services. You know, we rolled this out for healthcare workers. Was there any thought given to police and fire and how they're going to handle this? If they're not mandated to be vaccinated, Are we no longer allowing them to respond if this is really a concern of making sure that EMS providers are protected and people are protected and there's no transmission? I think we kind of stopped short of the entire EMS system with inclusion to police and fire. Those are my questions. That's my question, is how do I, does this affect my guys that are not EMS trained in going forward? And thank you.
Thank you, Chief. And I apologize ahead of time, Matthew Tarasevich.
Yes, Matt Tarasevich, can you hear me?
Yes, go ahead, Matt. Thank you.
Thank you. I'm Matt Tarasevich. I'm an attorney at Bernstein Shur, and our firm represents any number of towns, cities, and counties in the state of Maine that provide EMS and dispatch services. And I think you've heard from some of them today, and for the most part, they are against this mandate and seek other reasonable accommodations. I have a few questions as an attorney who's advising my clients that perhaps you can consider and provide answers to those who are listening today. And first, can we have an explanation of why dispatch center employees are included in this? For the most part, they don't provide direct or any medical services to patients. And as you've heard from some of the people today, they are already critically understaffed, and they
stand to lose more staffing if this applies to dispatch centers themselves. So some clarification on why they are included, or whether there can be some accommodation to help prevent what looks like a pending crisis for dispatch centers. Secondly, under the emergency rule, what does the term facilities mean? It doesn't seem to be defined in the rule. As you know, many of our public employers who have combined fire, police, EMS, and dispatch centers, when it talks about facilities and people being excluded from facilities, how does this rule apply to them? Are people going to be excluded from the entire facility, from portions of the facility? Can portions be segregated within a combined public services building? How does this going to actually work in practicality? Also, does it mean the building? Does it mean a parking lot? Does it mean any governmental building? Does it mean trucks or ambulances? What does this mean? It's in the rule, and my clients have been asking, what does this mean? So can we get some clarification on the scope of the term facilities? Next, what is the definition and scope of the term independent contractor as it is placed in section 1G of the definitions of employees in the rule? I understand how that might apply if you're a hospital who has like independent nurses who come in as contractors, but how does it apply to EMS departments and dispatch centers? Does it mean the plumber who comes in, the electrician, the pizza delivery guy? What does this mean as it applies to these types of providers and facilities? And finally, can we get some clarification on what it means if somebody gets a medical certification that they can't be vaccinated? If an employee comes in with a doctor's note that says they can't be vaccinated for various reasons, what happens next? Are there any accommodations to work around that? Can they have other things such as weekly testing, masking? The rule seems a little confusing in talking about getting a medical certification, but there's some confusion as to what actually happens next. I not only have 3 minutes, I could probably go on for an hour, but I think the people who are affected by this rule are entitled to some of these answers and some of this clarification. Thank you for your time.
Thank you, sir. Mark Dupuy, please.
Good morning. Thank you for allowing me to speak. My name is Mark Dupree. I represent the fire department of Wells. I'm the Wells Fire Chief, and I am speaking on behalf of the department. I think it's important to kind of note the kind of issue that we're going to be dealing with if this were to be mandated. And for the record, I am against the mandate, and for these reasons. I myself have been vaccinated. I fully support those that choose to. I also fully support those that choose not to. This is still America, the last I thought, and that's important that we continue to keep allowing our personnel to have a choice. As far as this affects the Wells Fire Department, my department consists of 3 shifts of 4 firefighters working full-time with 1 fire chief. We have only 6 on-call firefighters within the organization. All but 4 of our full-time members are vaccinated, or 33% have chosen not to vaccinate, and I support them for their decision. The 4 members that were not vaccinated have indicated to me in no uncertain terms that they will resign from the department if forced to vaccinate. Currently, 6 of my full-time members have been here less than 2 years. 2 of those younger members will change profession and move on with this mandate. 2 of my older or more experienced ones, one with 15 years and one another with 7 years experience, will also be leaving the department. This will leave the Wells Fire Department with only 4 members with my department with more than 2 years experience. In other words, 66% of my department will have 2 or less years of experience. This is dangerous for the remaining individuals in the department, and it's going to be a significant blow to ourselves and to the town of Wells. And trying to get more people to replace them might be difficult if every department is struggling with the same problem of people leaving. And in that case, I'll have to accommodate with overtime until we can find new personnel, something that this department can't afford to do, the town can't afford to do, and the members of the community are not going to get the services they were asking for. These are important aspects that I want people to consider. My concern is not primarily about the rights of our membership, although I do support them. It's more about how this decision will impact our town, the ultimate care of our citizens. Losing EMTs will have a large negative impact on our elderly community, our town economy, on the safety of our firefighters, and the overall quality of our emergency medical care. So I would ask you to reconsider this mandate. I would ask that you change this to highly recommend and to mandate continuous PPE usage until such time that it is deemed unnecessary. So allowing for our members to opt out for medical reasons and requiring to get this from the PCP is also not enough, in my opinion. There are many other reasons our membership does not wish to vaccinate for, and their concerns should not be minimized so that EMS can meet these political issues. Thank you very much for your time. I appreciate it.
Thank you, Chief. Joshua Lilly, please.
Good morning, everybody. My name is Josh Lilly. I'm the Deputy Director for the Penobscot Regional Communications Center, as well as the Fire Chief in Hudson. Speaking today, mostly on behalf of the Penobscot Regional Communications Center. That's where it affects me the greatest. Currently, we're down 5 positions, and we've got upwards of 5 more people that will not get the vaccination. That's almost a third of my staff. We are the largest PSAP in the state of Maine. We take over 60,000 calls a year. The scary thing for us, whether it's us at Penobscot or any dispatch center, is we staff our centers to the minimum to handle the calls that we take on a daily basis. So anytime that any center is down any positions, that affects how those calls are handled. And it takes a long time for us to train. I know that in our center, from the time we start the process of hiring somebody to the time that they're actually taking calls and working on their own, we're upwards of 6 or 7 months. So it's not even feasible for us to think that we're going to be able to hire somebody and get them in the seats working quickly. And as somebody pointed out earlier, and I tried to write their name down and I forgot, so I apologize, but we're not losing people just because of COVID. We're losing people because of our short staffing and the mandated overtime that people have to work. We've already lost people because of overtime crisis. We have been adamantly opposed to this mandate for many reasons. And then after Dr. Jarvis's speaking earlier, highlights even more of a reason for us to be adamantly against this. His numbers show an alarming trend of vaccinations not being very effective. I myself am a vaccinated person who ended up contracting COVID-19 and spreading it while being asymptomatic. I went to a wedding and spread it there. So I feel that making people get the vaccination is a little bit of a false safety net and does not do enough to mitigate those concerns. Secondly, or next, last week, my grandfather passed away. And one of the concerns that the doctors had at the hospital was that it was complications of the COVID vaccine. He ended up with a illness that is a side effect of the vaccination. So if our center is down a third of its staff, those calls have to go somewhere. And as Bill Tower from Sanford RCC mentioned earlier, those calls have to roll over to another center. I'm sure that the Department of Public Safety probably will not be expressing their feelings on this. But I just want to throw some numbers out there and speaking with their staff. They've got 4, so if we don't answer our calls, it rolls over to DPS in Bangor. They're currently down 4 positions and they've got another 4 that are not going to get the vaccination. That'll give them 8 empty positions and they have a staff of 13. These are alarming numbers simply because of the fact that these calls have to get answered by somebody. If they don't get answered there, they're going to roll over to another one of the DPS centers. And those calls are going to eventually get put into a queue and they'll get answered at some point. I completely, so I do as well have some questions. I want to know how Maine EMS is going to track these vaccines, who's going to be responsible for reporting them. What is going to be required of the employers? And I guess the other questions have already been asked, so I'll just wait to hear from them. And I do wholeheartedly understand that Maine EMS as a board isn't going to be able to stop this. I get that. I get that you guys are kind of in the middle. But as I sit here, I think I've been trying to count, and I think there's only been 2 people so far that have been in favor of this mandate, and everybody else has been definitely against it. And I'm looking at my screen, seeing a ton of hands up.
Sorry, you're approaching your time. Actually, you're over.
Yeah, and this is my last thought right here. I just want to say that I hope that we can all, all these that are opposed, we really need to stand up and we need to take this beyond this board so that we can find or stand up for what's right and get this mandate stopped. Apologize for going over and have a good day, guys.
Thank you, sir. Appreciate it. You too. R. Chase, you're next.
Good morning. Can you hear me?
Yes, all set.
My name is Robert Chase. I'm the fire chief for the city of Auburn. I am vaccinated. I am pro-vaccine, and I have countless hours in vaccine advocacy with my staff and throughout the community. The only thing that I think everyone on this call can agree upon is that there is nothing that we can do, including vaccination, that will completely eliminate the risk of COVID-19 from our providers, from our patients, or from the community at large. We cannot eliminate this risk, so we must manage it. In the managing of a risk, we should be looking at all of the options and all of the unintended consequences of those options and of those actions. For me, I've been standing on every mountaintop that I can to express the incredible risk that this mandate will have on our ability to provide all of the emergency services that are found within our fire and EMS organizations. That is a very real risk, and I think you can see that by the overwhelming support of individuals on this call that have said this will have impacts on their ability to staff and do their jobs. I think this mandate is and will be considered a detriment to the EMS and fire service in Maine for years or decades to come. Virtually everyone on this call has affirmed that with the input from their organizations, this is going to have negative impacts on their ability to do their job. So my question, what advocacy did Maine EMS formally or Maine EMS staff do with the CDC in the adoption of the CDC rules? If Maine EMS advocated for this mandate, we need to ask why all of these consequences weren't considered, because certainly by the outpouring that we're hearing on this call, there's plenty of information out there about the impacts that this will have on organizations. I would ask Maine EMS to not further confuse the issue by publishing any of your own rules. I think that if the stand is that the CDC rule is independent and stands on its own, there is only confusion that is added to the situation if Maine EMS now jumps on board. And lastly, I would say that you adopt a resolution requiring Maine EMS to advocate to the greatest possible extent to the Maine CDC in opposition of any continued mandate or any further unilateral rule adoptions that negatively impact the EMS industry. Thank you.
Thank you, Chief. Miles Villalobos, please.
Good morning, Chief Libby. Can you hear me?
Yes, you're all set. Thank you.
Thank you. My name is Miles Villalobos. I am acting paramedic chief for Pleasant Point EMS, serving the Passamaquoddy tribe in what is now Down East Maine. I am also an instructor for United Training Center. And at our last meeting, I was voted in as co-chair of the Maine EMS Community Paramedicine Committee. I have no questions. I don't want to argue the severity of the virus or the efficacy of the vaccine. All of the questions have already been asked. Really, the comments have already been made. I'd like to echo what Mr. Chase just said about a resolution from Maine EMS. We understand your position that you are in the middle, but we also see you as our advocates in a sense, our voice, and I think 600 to 700 people showing up today is proof of that. That we don't feel like we're being heard, nor do we really have the time. I'm struggling to keep my service as a service. We're currently working with 3 providers, and at this rate, with this mandate, the vaccine mandate, we will lose 100% of our providers. And that's just for my service alone. We were just in the midst of this intentional transformation of adapting to this new normal. EMS, rural EMS in particular, tribal EMS especially, was in crisis mode before the pandemic. We have been struggling to survive since then, and we're just in the midst of being able to adapt to that. And then literally a day later, this mandate came and destroyed any possible hope whatsoever of us fixing the system here in rural Washington County. Not only will we lose many of our providers, we will lose access to our first responders, which are integral to our response, as well as the dispatchers. My plan B is out the window because those who can't do teach, but I would still be mandated as an instructor. So there's not many options left to me. But really, I think the biggest takeaway here is the huge impact of this ill-conceived, short-sighted, far-reaching mandate. We need more time, and I would urge the board to push back as hard as possible to buy us some time to have these conversations, have these questions answered, have our concerns addressed. Otherwise, this will spell the very collapse of the rural EMS system that was, again, already in crisis mode before. To echo some of the other comments, Lori Rice from United, one of my colleagues, whom I respect greatly and has a huge job on her shoulders. The unfunded mandates will affect us just the same. To Paul's point, I'm glad I missed Dr. Jarvis's comments, I think. About unanswered calls has nothing to do with COVID. We had one yesterday. It was an overdose that went unanswered by us. Mutual aid service did respond. But the first 2 people that showed up on scene that saved this gentleman's life were cops, our local law enforcement, 2 of our police officers who are actually 2 of my EMT students who will no longer seek licensure if this mandate continues. In addition to that, my workforce, anywhere between 50 to 60% of tribal members are not vaccinated. They have chosen not to be vaccinated. And therefore, if this mandate continues, the dozens of people that I had on my list to bring in and become licensed through an EMT class, they're not going to sign up. This will be devastating for us, not just for the reservation, but for all of Washington County. We do ALS Intercept for a variety of services. One is a volunteer service. They'll run into the same predicament of not being able to answer the call. I would just ask for more time at the very least, so we can talk about expanding the exemptions, alternatives. We have been doing this for a year and a half. I take offense to being called not a team player by some folks. We have been doing this for the past year and a half, over a year and a half. We've kept ourselves safe, our patients safe. That's our number one priority, and we would very much like to continue to do our job. That's all I have for you, Chief. Thank you.
Thank you, sir. Appreciate it. Chris Wytock, you're next.
Yeah, Chief, can you hear me?
Yes, you're all set. Go ahead.
All right, thank you. Obviously, I think most of my comments are what have already been said, so I'll be pretty brief. But a concern that I think we've all echoed consistently, I think we can argue efficacy, even though the science is there. We can argue, severity of illnesses, even though the science is there. But I feel like one thing that nobody on this call who has at least spoke so far can argue that the effects that this is going to have on staffing. First of all, I will just say professionally, I'm against the mandate. I'm the fire chief of the city of Rockland, and I have 25 people. I've got 100% compliance with my staff, so my staffing won't immediately be affected, but long term, we're already having a challenge for the state hiring people, and from the fire and EMS standpoint. The running joke for years is that this is our second job. So we work the fire and EMS realm, for good health insurances, good benefits, good retirements, and then a lot of other people, have a trade that they work on their days off, and the reality is those people will have a place to go. They'll have a place to go to make more money. They'll have a place to go to keep their family livelihoods going. They're there, and the shortage that trades are seeing right now with staffing are going to be filled with a lot of fire and EMS personnel who will spill over into that side. And while I think some people probably throw idle threats into that, I feel like a larger majority of the people who say they're going to go are going to go. And when that happens, we're all in a world of hurt. And when you can hire a firefighter paramedic for $19 an hour, and Walmart's hiring people to stock shelves for $21 an hour, you can't argue with that point. And I feel like we're going to be there. And again, a little bit more time. I think I'll echo what the previous gentleman stated. More time may be of value to us. But I think overwhelmingly the staffing issue is going to be our immediate and our long-term effect. So thank you very much.
Thank you, Chief. Adam Mason, please.
Afternoon, sorry about that.
No problem. Go ahead, sir.
All right, so my name is Adam Mason. I work for several agencies in the southern part of the state. I'm not representing any one of those agencies. I'm speaking on my own behalf as a licensed paramedic in the state. I am vaccinated. I did so as soon as possible. My two major concerns are concerns that have been voiced by a couple of people. The first one I have is the time frame on this. Unfortunately, to become quote unquote fully vaccinated, it takes one dose of either Pfizer or Moderna, 4 weeks later, 3 to 4 weeks later, a second dose, and then 2 weeks to build antibodies. So that's a 6-week window. And at this point, the October 1 deadline is essentially unattainable. So that's my first concern, is that that deadline won't work in the timing. My second concern is what's been voiced by several other people, is there needs to be an alternative to this. I think everyone should be vaccinated. This is not about us. This is about protecting our patients, which is our primary goal. So for us to do so, I believe that we need to either be vaccinated or have some means of protection, which was addressed months ago when the ENVOs were being used down in my part of the state, that we had to block the exhalation valve. There needs to be some means for an unvaccinated provider, for whatever reason they're not vaccinated, that they need to be able to still offer protection to their patients. So if that is a surgical mask and that's deemed acceptable, then that's the case. If it's an N95 without exhalation port, then that needs to be the standard thing. I understand that the role of the CDC is not just looking out for us as providers, it's looking out for the general health of the state. And I think those are my two concerns, that the deadline is too short and we need an alternative to the vaccination that is acceptable to the CDC on how you would prevent transmission, because I believe that's the goal, is not protecting us from our patients so much as protecting our patients from us. And I appreciate everybody's time on this matter. Thank you.
Thank you, Mr. Mason. Appreciate it. Theodore Marshall, please.
Good morning. Thank you, Chief. Everybody hear me okay?
Yes, you're all set. Go ahead.
So, thank you. I am fully vaccinated. I'm a firefighter paramedic for a couple different towns. My views are my own and not of the departments I work for. My concern or my question is what data did Maine CDC use to support this mandate for Maine EMS? Is there a trend where they're seeing Maine EMS providers transmit the coronavirus through our PPE onto the patients that are also supposed to be masked while being treated as by Maine EMS standards? Are they seeing that we are increasingly transmitting to these people? And if that's the case, is there additional comments to be made about adding more PPE to our daily calls? Or is this mostly just anecdotal stories that help support their mandate and not actually using data? Thank you.
Thank you, sir. Caitlin Demers, you're next.
Hi, can you hear me?
Yes, you're all set. Go ahead.
Okay, my name is Caitlin Legary. I am an assistant chief of EMS for one department, and I'm also a member of 3 other departments. My main question is, how will this mandate affect dual role departments? So I will cite the Maine Fire Chiefs Association. There's 273 EMS services in the state of Maine, 172 of them being EMS departments that are based in fire. So if we have these dual trained personnel who are currently licensed in the state of Maine refusing vaccinations, are they going to be able to work solely as fire, or will they be able to work in any capacity at all, or will the department have to refuse these people on the department? I've heard many people touch upon the lack of personnel. I'll just say for one department that I'm on, of 2 per diems, we'll lose half of our per diems and 1/3 of our EMS provider staff if this mandate goes through. I believe in testing for every patient to provide information on exposure. I also believe that people should have the right to choose. I believe that the recommendation should be up to the service and providers based on their risk and benefit analysis. I'll also say that phase 3 studies usually take 3 to 5 years for long-term effects, sometimes up to 10 years. And I'd like to echo the PPE requirements for every call where there's a potential for COVID patient. And I'd also like to say that there are other ways to boost your immunity to COVID-19 other than using a vaccination. Thank you very much.
Thank you, Caitlin. Jesse Walker is next.
Hi, I'm Jesse Walker from down in Machias. I'm a medic there in Washington County. I'm not speaking for my agency or any of the other agencies that I mentioned. I have several different questions that I would like to hear addressed by the board at some point. In the rules that were put out in section 3, discussing exemptions, in paragraph 4, it's listed that exempted persons must receive a Binax Now test 3 times a week if available for response to emergency medical calls. However, in January, in the 3.0 playbook that was put out by Maine EMS, the use of Binax Now tests is no longer recommended. So I'd like to know if there's new data on the efficacy of using Binax Now for surveillance testing. It is likely to be extremely cost prohibitive for many services in the state. I'm also curious about any discussions that have been going on relating to diversions in rural counties and meeting the transfer burden. We have 2 hospitals in our county that are critical access hospitals, and unofficially staff from those facilities are talking about significant staff losses that will effectively shut down OB departments, radiology departments. Our next nearest facilities are well over 45 minutes away. So how are we going to deal with diversion for routine medical calls and then still be expected to cover our massive emergency coverage areas? We routinely work with at least 8 other EMS agencies, some of which are expecting 50% staff reductions. We routinely work with 8 area volunteer fire departments, and they have questions if they're going to be able to help us with lift assist, with CPR calls. We depend on them for that. The majority of our department is staffed by volunteers. The majority of our fire departments in the area are staffed by volunteers. We can't afford to lose this many people in our police, fire, and EMS agencies or at our critical access hospitals. So we need to see some response from the board about how we're going to deal with the increased transfers, potential for diversions, and meeting call volume in a reasonable amount of time. People want to know, are we going to be required to receive a booster? Is there an expectation that we will have more severe vaccine reactions to 3rd doses? We did have at our agency alone several people that missed at least a day of work just dealing with vaccine reactions. They're fine now, but that's a big deal to us when we have providers that are routinely working 168 hours a week to stay in service. Any information that you guys can give to us about these concerns would be greatly appreciated. Thank you.
Thank you, Jess. Scott is next.
This is Chief Richard Genther from the town over. I'm down here in Bristol. We're dual viewing this. They just got back from a call, so excuse the noise. So one of the concerns we've had and has been brought to my attention as a fire chief and as a first responder service, one of my members brought up the point of this mandate pretty much nullifies the religious exemption and how that's going to affect his ability to be on the fire department. And then as a group, we got together a couple weeks ago, and a lot of the fire chiefs that provide first responder services in the county of Lincoln County, a lot of us are actually considering removing our first responder services due to this, and that's going to put a massive burden on all of the EMS services in our county. So I'd like to know what the board is going to do to address these concerns, because, you know, as first responders, we all rely on the fire department for lift assist, additional personnel on scene. And if all of a sudden now they're all being mandated to have this vaccination, that's probably going to eliminate a lot of first responder services, just off the opinion of that, right? I'm lucky enough, I have literally one person out of my 13 people that have all gotten the vaccine. So it's just, what are we going to do to ease those concerns and those burdens on everyone else that's going to be strapped from this? Thank you.
Thank you, Chief. Chief McDonald.
Good morning. Can you hear me?
Yes.
All right. Good morning, everyone. My name is Amy McDonald. I'm the Deputy Chief of Lisbon Emergency. I want to start by saying we are opposed to this mandate. Just like many other services, we're predicted to lose about a third of our providers. I have two questions. My first question is, with the loss of the revenue that is foreseen in our organization, and any organization for that matter, with this mandate, will the state be taking any responsibility for the loss in revenue? My second question is, will this be a permanent mandate, or will this be something that will be resolved once the numbers go down again? Thank you.
Okay, thank you, Chief. Next is Harley Quarian.
Hi, can you hear me?
Yes, go ahead.
So my name's Harley. I'm an EMT at Delta Ambulance. I am not speaking for them as a company, just for myself.
Okay.
I'm opposed to the mandate. People continue to talk about risk versus benefit, but why not allow us to decide for ourselves and our families, rather the benefit outweighs the risk or not? Instead, it forces us to choose between being forced to take a vaccine or risk our income and our ability to feed our children and provide for them warm homes. This will force people to walk away from an already short-staffed workforce and will be detrimental to our patients that they continually talk about protecting. Also, there have been significant amount of breakthrough cases in the vaccinated, so forcing the vaccine still does not eradicate the risk of passing it to patients and potentially gives a false sense of security. I'd like for the board to propose an option for weekly testing and masking if providers choose to decline the vaccine. I continue to hear people will cave and get the vaccine, but with the severity of short staff, is that something we really are willing to chance the whole EMS system on, is people caving? That's all. Thank you.
Thank you, Harley. Appreciate it. Next one is OBI FD user.
Hello, can you hear me?
Yes, all set.
I am. Thank you for hosting this and listening to us. I'll touch on a few points, many of which have already been raised by a number of the participants. My name is Sean Hall. I'm a captain with the Orrs and Bailey Island Fire Department, and I'm speaking today not as a representative of that department, but on my own behalf and as a proxy for a number of us who have some concerns. I'm opposed to this mandate for two reasons. First, as a matter of personal liberty, and secondly, due to the impact this mandate will have on emergency services organizations throughout the state, which I know has been touched on quite a bit during this meeting. With respect to personal liberty, I believe that mandating vaccinations, particularly those still under emergency use authorization, represents unprecedented government overreach. Even more so in that these vaccines do not necessarily confer immunity or stop transmission, but merely minimize symptoms in the infected. Dr. Jarvis stated at the beginning of this meeting that breakout cases among the inoculated were fairly low, but US CDC data show that 74% of infected individuals in a Massachusetts infection cluster had been fully vaccinated. I don't understand the efficacy of requiring this for us as emergency medical responders when we've made it through kind of the peak of the infection using PPE and minimizing our infection rates. I believe too little is known about these vaccines and the potential long-term side effects to mandate their use, and the declinations for medical, philosophical, and religious reasons should be considered and permitted in addition to medical waivers. When it comes to the impact of this mandate on emergency services organizations, I know this has been spoken about quite a bit, but this mandate, it's written to target healthcare organizations, but with respect to, the impacts downstream, as my chief is interpreting it and a number of folks that I've spoken to, that it will apply to non-EMS firefighters. It will affect our drivers, our scene support people, our junior firefighter program participants, as well as administrative positions within a number of the departments. My department stands to lose about 1/5 of our responders, not all of them firefighters or EMS. It's having an impact on recruiting. We have questions about individuals who we were going to send to EMT school and fire school and how this will affect them down the road. So it is already, just as a mandate, even before its implementation, affecting our ability to recruit. And it will certainly affect our ability to retain members. I would like to echo Chief DeQuee's recommendation that Maine EMS support a change in the language of the mandate from requiring vaccinations to highly recommending vaccinations, and leave it to the individual responders as a matter of personal choice. That is all I have. I appreciate you providing me with the time to speak.
Thank you, Captain. Appreciate it. Next will be Kelly McCoubry.
Can you hear me?
Yes, Kelly, go ahead.
Hi, my name is Kelly McCoubry. I'm a family nurse practitioner, and I'm representing myself, not the company that I work for.
Okay.
I just want to say thank you very much to all of the EMS and firefighters who are sticking up for this, and sticking up for all of us. I am strongly opposed to this mandate. Drug companies are always boasting the reason why it costs so much to buy drugs is because they're on the bench in vitro for a minimum of 4 years for common diseases. Other vaccines that have been approved take decades to bring to market. This expedited process is unheard of, and the Ebola vaccine killed 50 people and it was taken off the market. We're going crazy. This is crazy. As of August 6th of this year, in this country, there have been 12,791 deaths, 13,139 life-threatening adverse events, 16,044 cases of permanent disability, over 121,000 hospitalizations and ER visits following COVID vaccines. I think this is a very conservative estimate because it's estimated only 10% of adverse reactions get reported to VAERS. Today, I hear Pfizer has been approved without going through the clinical standards trials and the normal FDA approval process. To force us to take an experimental vaccine where there is no recourse in the event of bodily injury is a very high risk to require someone to take to keep their employment. The Nuremberg Code is the most important document in the history of ethics of medical research. It was established 74 years ago to prevent society from repeating the atrocities committed by the Nazi scientists and doctors in concentration camps. Since then, it has served as a blueprint to ensure the rights of subjects in medical research. According to the Nuremberg Code, medical experiments require voluntary consent without the intervention of any element of force, fraud, deceit, duress, overreaching, or other ulterior forms of constraint or coercion. This is coercion. This is not consent. I think many of the people that I know in Washington County are walking off their jobs. Many are looking to get out of state licenses. This is going to cripple our healthcare. Please reconsider what you're doing here. Thank you very much.
Thank you, Kelly. Amy Davenport, Dakin, please.
Can you hear me?
Yes, Amy, we can hear you.
Okay, thank you. My name is Amy Davenport Dakin of New Perceptions, and I am a licensed mental health clinician in private practice. I'd like to speak to the behavioral health ramifications of a forced mandate. I only see firefighters and EMS personnel, and I am the behavioral health director for the behavioral health program with Professional Firefighters of Maine. We as clinicians are still trying to help many cope in a pandemic, and resources have always been limited even prior to the pandemic. Now we are even more stretched. Some numbers circulated in general, our crisis calls are up 800%. Many EMS personnel also fielding these mental health calls. We all are working around the clock to help contain people, their reactions, and their emotions. We have been concerned as time goes on, there'll be more ramifications of this pandemic, and here we are. I'm against the forced mandate as I wish there could be more methodical approach and implementation as others have stated, and for the reasons others have stated. I'm already dealing with a population of first responders that are burned out, overworked, scared for themselves and their families, as well as the public. Now I'm dealing with both sides, people that will be forced to more overtime if they lose staff, as well as others that have lost all their power to make informed decisions about their own health care. I've been dealing with numerous interventions in crisis that first responders are going to lose their jobs and can't provide for their families. Many understand patient care and are willing to protect their patients. Our mental health system is being overwhelmed with a sudden deadline and panic about sudden job loss. I'm dealing with a community that is feeling betrayed and lack a sense of control when they have sacrificed time with their own families to care for others during this pandemic. They have all been willing to follow all procedural protocols and measures. They are willing to follow any other recommended protocols to keep the public safe. One of my questions is, how are we going to handle the emotional ramifications and provide psychiatric support to members that are currently in crisis and needing support to manage this mandate? We are dealing with a population that is already at high risk of suicide by virtue of their trauma exposure. Now we're adding another stressor that makes many worry about how they'll care for themselves and their families. We are dealing with a mental health system that is already taxed and unable to meet the psychiatric needs during this pandemic. Thank you.
Thank you, Amy. Andy Turcott.
Good morning, Chief Libby, Commissioner Shah, board members, and my fellow peers. My name is Andy Turcott, and I'm the Fire Chief of the City of Westbrook. I'm also on the Atlantic Partners EMS board, but my statements are my own as a paramedic and nurse, and they do not represent any one entity. As we all know, EMS providers continue to be on the front lines of the state and nation's fight against COVID-19. While I understand and respect the passion regarding both sides of the issue, I urge everyone to take another look at the science. Most everyone here today has COVID fatigue. There's no doubt about that. And the only true way to pass the pandemic is through vaccinations. For those who are concerned or hesitant about getting the vaccine, I would share with them that normally, because there are such few patients that are enrolled in the study, it takes a long time to look at the adverse effects. This has not been the case for the COVID-19 vaccines. There have been several clinical trials across not only the country, but across the world that has clearly demonstrated that the vaccines are over 99% effective against hospitalizations or death from COVID-19, and that serious side effects have been extremely uncommon. We have also been able to look at real-world performance of the vaccines over the last couple of months and what has become one of the largest biological studies ever performed, as there have been over 5 billion doses given worldwide. And again, they're seeing very, very few severe side effects in real time. While this does not mean that we do not need to see long-term studies, it does demonstrate that there is confidence in these vaccines, that they are safe, that they reduce illness, hospitalizations, fatalities, and that vaccinations truly are life-saving. Furthermore, we're required to have certain vaccines to go to school or to be able to work in the healthcare field. I look at this no differently, especially now that Pfizer has received approval from the FDA. While I do believe in personal choice for most things, there are times when we have to look at the greater good. I do, however, believe that our dispatchers, at least at this point in time, should be exempt, given that they are not on the front lines. And I also believe that those with exemptions should be able to also not get the vaccine. But at the end of the day, we all took an oath to do no harm. So I urge everyone to try to think intellectually and not emotionally on this issue, because this is emotionally charged. But at the end of the day, it's my opinion that vaccine mandate will certainly help us keep everybody safe and will help us get past this pandemic that much quicker, and it will help ensure that our healthcare system remains intact. Thank you, Chief.
Thank you, sir. Roger's phone is next, but it does not appear that there's audio.
Chief, I don't even have the option to ask this individual to unmute because they don't have audio associated with their login.
Okay.
I guess we could ask Roger if he wants to email comments in. Like, that's an option, I guess.
Looks like it's connecting to audio.
Oh, okay, there we go.
Or trying to anyway. Give him just a minute. We'll check back with Roger's phone. And in the interest of time, we'll go to Brian Trefethan next, please.
Hey, Chief, can you hear me?
Yes, all set, Brian.
All right, well, thank you, Chief, and the rest of the board for having public comment today. This will be short and sweet. I'm a firefighter paramedic for 2 different communities in Cumberland County, but I am speaking on my behalf today. I am not anti-vaccine, but I am anti-mandate. I have a question for Maine EMS, and then a few comments to follow. But my question to Maine EMS is, since the start of the pandemic, what is the COVID-19 rate of transmission to EMS providers wearing appropriate PPE with positive COVID-19 patients? And then just to follow up with a couple comments here. Like myself, most of us work 2 to 3 EMS jobs. So even if one provider decides to leave due to this mandate, multiple communities will be losing a qualified EMS provider. And that's why I believe this mandate will do more harm than good to the public that we serve. And just as the last thing, Commissioner Sawchuk said in his opening statement, if the front end of the system is broken, then the back end can't function. And this mandate is breaking that front end. Thank you, Chief.
Thank you, sir.
It looks like Roger's iPhone is ready.
Yes, Roger. Looks like you're unmuted. I can't hear you. Roger's phone. Do you want to try that one more time? And you are unmuted, but no audio to go with it. Next up will be Jody Fournier, please.
Hello, this is Michael Sherman, the fire chief for Litchfield Fire and Rescue. A bunch of us crowded around the computer here.
Okay, Chief, go ahead.
Thank you. I will be brief and echo in a large part what the vast majority of people on this call have already said. Litchfield Fire and Rescue stands opposed to this mandate. We do not stand opposed to vaccinations. The fact that in order to be in opposition to this, an organization or an individual is frequently painted as anti-science or anti-vaccine is an absolute outrage. And anyone who has a respect for science should appreciate opposing scientific viewpoints. And when it comes to the COVID vaccine, the data on that is vast. There are many opposing viewpoints. The simple fact is, whenever an organization or an individual allows government overreach to this degree, one must ask themselves, where does it end? I had a member the other night when we were speaking about this in our monthly meeting ask me basically that. With the booster coming out and the goalposts continually being moved on COVID-19. First it was you don't need a mask, then you need a mask. Then we need 15 days to flatten the curve. Now we need a vaccine and that'll just solve it. On and on it goes. Now we need a booster. When does this end? Obviously, no one knows definitively. Therefore, the right of the individuals to decide for themselves their own health decisions with something as new as the COVID vaccine and with one-sided science coming from government mandates, clearly this is not the way forward for free people. Litchfield stands opposed to this, but make no mistake, We do not oppose sound science. We do not oppose vaccinations. And we certainly, like so many on this call, want the very best for those whom we serve. Thank you very much for having this meeting and allowing public comment. And my question for the board would be, and I would like this answered specifically sometime at the conclusion, is when and through which medium can we expect to receive some of the answers to the questions that have been asked today? Thank you very much, Chief.
Thank you, sir. Greg Payson, you're next.
Good morning.
Good morning.
Greg Mason, Chief of North Carolina Fire Rescue. A couple questions, comments. I am vaccinated, and as myself personally, I do not want to see the mandate. I do not speak for my agency on that. However, I do speak for a couple of my members of my agency. I'm fortunate enough I have 100% vaccination on my EMS side of things, but on the fire side of things, I do not have 100%. What's the ramifications if my staff do not get that vaccination? And as an employer, I don't terminate them as of October 1st. I'd really like to see you guys push that timeline back beyond that October 1st date, because I don't think it gives our providers enough time to make their decision on being forced. It's pretty much my only comment I had, but thank you for taking the time today.
Thank you, Chief. Sean Essler, you're up next.
Chief, can you hear me okay?
Yes, loud and clear.
Perfect. My name's Sean Essler. I'm the fire chief here in the city of Waterville. I want to first say that I am pro-vaccine, and I personally have made the choice to be vaccinated. I do want to note here that I'm incredibly proud of Waterville employees as well as our EMS personnel across the state that have responded to this COVID pandemic. We've done honestly a great job. As I stand today, I am opposed to both the emergency mandate and the Maine EMS rule. It comes with consultation with my legal team. We came up with more questions than we did answers. Specific to the mandate, I question employer liability. I question the facilities definition. I question the subcontractor definition. If somebody's going to work on my ambulance, do they fall under the requirement of being vaccinated? And it draws question about non-licensed fire personnel as far as exactly where they stand. Specific to the Maine emergency rule, the timeline to implementation is completely unreasonable. September 1st reporting date for, as written in the Maine EMS rule, is unattainable. And I would ask for clarification on the Bionex Now testing question that another member brought up. I have concerns that revolve around the mental health of our employees. Losing employees, I've already had a career termination, a career resignation here in the city of Waterville over this. And we're expecting that most of our volunteer departments around us will see a significant reduction in service. So in closing, I would just ask that the Maine EMS committee put together a resolution to oppose the mandates by the CDC. And again, I would echo the comments of a vast majority of the people on here. So thank you very much for your time today.
Thank you, Chief. Chris Thompson, you're next, sir.
Hi, my name is Chris Thompson. I'm the president of Local 740 Portland Firefighters. Following an unanimous vote of our executive board, we stand with the Maine fire chiefs that have spoken against this mandate. We've worked about a year and a half now without a work-related COVID case. We wear rated N95 masks and PPE like the rest of us do, and we've have means to screen ourselves. We don't feel that we pose a risk to the public. Right now, we aren't really debating whether or not the vaccine is good. We're debating the mandate. The mandate isn't about forcing a group to get vaccinated. We're just talking about firing the people who aren't vaccinated, and that's not the same thing. We have members who will walk. Our profession is where people with strong principles go to work. We're already understaffed. Our dispatch is over 30% understaffed. Some of these guys are forced 4 times a week already. We are on the verge of folding. The Portland Fire Department already needs to prepare for another drill school when the current one graduates, unrelated to this mandate. We're facing a new wave of this pandemic, understaffed and way stressed out. And this conversation is adding more stress. Those who aren't let go from this mandate are going to be expected to pick up the slack. This is going to cause a cascade effect as our members retire early, walk away, or go on stress-related leave, and we're seriously worried about meeting the mission. Allow us to work with our PPE. We pose no risk. The only real risk to protecting the public population is from this mandate. As EMS providers, we take a patient's rights very seriously. People should have the right to determine what happens to their body. Give us that same courtesy. Thank you.
Thank you, Chris. Monica is up.
Hi, can you hear me?
Yes, all set, Monica. Go ahead.
Hi, so my question is to, for the mandate going forward, if it does continue to stay in effect, what is gonna happen with the boosters? Where some have received J&J, they don't wanna receive Moderna or Pfizer. So going forward, what is gonna be the consequence to them? And for people who, have received Moderna or Pfizer, what happens if they do not elect to get the booster dose? Thank you.
Thank you, Monica. Robert's iPhone.
Hi, my name is Robert White. I'm a firefighter in the city of Portland. I'm obviously speaking on behalf of myself and not the city of Portland or the Portland Fire Department. I'm opposed to the mandate. I have a couple questions. The first being, how many cases of confirmed cases of COVID being passed from EMS provider to a patient have we had in the state of Maine? And if so, in those cases, how many, if any, of the EMS providers were wearing proper PPE, i.e. N95 masks? I've also heard a lot today, a lot of comments for people who are for the mandate, who mention the health of the providers. I take my own health very seriously. I eat healthy, I exercise on a regular basis. According to the CDC's own stats, I'm at very low risk of death or serious hospitalization from COVID-19, whether it be any of the variants, Delta included. And so my other question would be, is the state of Maine going to mandate healthy behavior by all EMS staff? For instance, just in the country, as an overall number, 500,000 people die each and every year, or roughly 500,000 each and every year from smoking related illnesses, to include over 40,000 who are secondhand smoke, innocent victims each and every year. We don't mandate that our members not smoke cigarettes or not eat unhealthy or not be obese. So again, I am opposed to this mandate for many reasons. I'm not opposed to vaccines in general. I'm highly vaccinated more than most. I've had smallpox vaccines. I've actually had 6 anthrax vaccines, and because those things will kill me if I contract them because of different parts of the world that I travel to. So I'm not against vaccines in general. I'm just not for necessarily a vaccine at this point that for an illness that I have little risk from. So that's all I have. Thank you for taking public comments, and have a good day.
Thank you. You too, sir. Mike Choate, please.
Morning, everybody. Thank you for allowing people to speak about this. My name is Mike Choate. I work for Lifelight of Maine. My opinions here are that of my own and not of our organization. I'm the quality assurance and process improvement coordinator there, and what I love the most about my job is trying to affect change that is going to see benefit. And with respect to mandates, governmental mandates, I am opposed to those for personal freedom reasons. However, I feel that for the benefit of healthcare, for the benefit of public health, that there are times when things need to be added. My opposition is not to mandates. It's that you should be an advocate for things that are going to produce an outcome. And if the board and Maine EMS has the intent in mind to not allow providers to transmit COVID to their patients and to their colleagues, then I feel that an appropriate mandate would be something related to masks and protective eyewear. The beginning of this pandemic was, the deaths were related to those that were unmasked. And now it's related to those that are unvaccinated. And the problem with what happened when our world stopped wearing masks, we realized that you could have COVID even if you were still vaccinated. So I do not believe that the answer to preventing the spread of COVID in our organizations is vaccination. I believe it's masking and protective eyewear. And I do 100% support employers that want to protect their assets. And I'm 100% for vaccinations, but I don't believe that that's for the government or for the Board of EMS to decide. I think that that should be left up to the individual organizations, and that a mandate more appropriate for what would actually produce an outcome is what we should look at. Thank you.
Thank you, Mike. Justin Bartlett, you're up.
Thank you, Chief. Lieutenant Bartlett, Old Town Fire. I'm also the Vice President, Local 1655. And speaking on behalf of our local president, to say that Old Town Local 1655 opposes this mandate. I'll keep it brief. I'm not gonna say anything that somebody else hasn't already said, but concerns of staffing when people do leave. Also concerns with the mental health of the guys that are getting vaccinated under the mandate, and the stress that's going to put on them. That's all I have. Thanks, Chief.
Thank you, sir. Samantha Small, you're up.
Hi, can you hear me, Chief?
Yes, go ahead.
My name is Samantha Small. I'm a paramedic for a rural department here in Washington County. I'm also a state of Maine instructor. My opinions are very much my own. They don't represent any entity that I'm employed with. I just want to reiterate, like Miles said, as an instructor in rural Maine, I've had many people come to me wanting to take a class, wanting to get involved, wanting to help. And with this mandate, we're finding that those people no longer want to because they are not able to make a personal choice. I've heard conflicting data today regarding the state's high vaccination rate, but yet we have cases climbing. I don't really understand the data there. There should be medical exemptions for those with severe reactions. I personally know of several. I myself am vaccinated. I made that choice. I am pro-vaccination, very much against the mandate, but I've always welcomed conversations with my peers regarding the risks. I've had people come to me asking what my opinion is, what my take on the science is, and I've convinced people to get vaccinated. But I don't think that Maine EMS should take the opinion or support DHHS and the CDC. They're an agency that can't really understand the concept of a high caseload not being able to be used as an excuse. My son was exposed in his school, and I was notified by contact tracers by the time his quarantine was up. And when I asked what the delay was, they just told me that they were overwhelmed in their caseload. As we all know, in EMS, fire, EMD, we don't have that ability. Those calls have to be answered. And as several of my colleagues have stated, those calls have to be answered by other departments. Miles talked about a call he had in his department yesterday. I happen to live in the town that responded to that call. That left my town uncovered by an ambulance, which, we all cover for each other, mutual aid, but it's just going to get worse and worse and worse. Not just 6 months ago, we were all regarded and applauded for our passion for this job, and now it's being used against us. And I don't think that's right. I would like Maine EMS to take a stand, as the Maine fire chiefs have, and support their staff and support us as we have supported them over the years. Thank you, Chief.
Thank you, Samantha. Appreciate it. John Cummings, please.
Good morning. Can you hear me?
Yes, sir. All set.
Thank you for your time and the opportunity to speak. I'm John Cummings and a paramedic at Central Aroostook Ambulance and 2 other services here in Aroostook County. As everyone else said, I'm not speaking for my service, but as my own opinion and view. I am fully vaccinated, however, personally opposed to a mandate for the vaccine to EMS providers. As many other services and experienced providers have stated, this ruling will have far-reaching and long-lasting implications on EMS services throughout the state of Maine. We all struggle with staffing on a daily basis already. The mandate will only add to this struggle. We can't afford to lose any of our staff and cripple the services that we currently provide. Our service alone is going to lose 50% of our drivers, which is going to be detrimental in providing emergency service to the citizens we protect. Not only are we going to lose drivers, but we'll also be losing volunteer firefighters at fire departments that we rely upon for lift assist and first responding to emergencies, which is detrimental in saving lives, as we all know. We've made it this far in the pandemic wearing the proper PPE, and has been proven to be effective deterring the infection rate. So why add another mandate of mandating a vaccination? In closing, I ask the board to consider not adopting the mandate, and thank you for your time.
Thank you, Mr. Cummings. Eric Wellman, you're next.
Thank you, Chief Libby, and thanks for letting me speak. My name is Eric Wellman. I'm an employee of the Maine Community College System. I am representing myself in this speech. I am a proponent of vaccination. I understand that mandatory vaccination is not something anyone wants to go through, and those kind of things. This is a public health emergency, and we do know that vaccination does reduce the effects of a public health emergency, and I think it's important for us to all remember that. I think there's many factors that we all consider. But I think the bigger thing I want to say here, and I hope everyone understands where I'm coming from with this, every one of you has talked about staffing. Every one of you has talked about pay. Everyone has talked to you about being over extended and everything else. One of the things that we have not done as a group is unified and come together and say that we need more money for our system. This has been more of a watershed moment than anything else. It has recognized that for years we have underfunded our system, that we have functionally tried to do things on the shortest amount of money humanly possible. And it's a lot of the reason why this is a huge issue for us right now is because we are completely underfunded for the things that we need to do. And I think that is a major reason why there's so much pushback against this, is because the reason that we don't have tons of people walking into our field is because they don't want to do the work for the money that we offer. And I think that's an important piece for us to remember. So as you're discussing this, I think that's an important thing that maybe you want to discuss as a whole, is that potentially some of this COVID money that is flying in from various sources may be best suited to paying our providers more, which may help some of this issue in the long run. Thank you.
Thank you, sir. Melinda Fairbrother Dyer.
Thank you. Can you hear me, Chief?
Yes, all set.
Thank you. My name is Melinda Fairbrother Dyer. I'm the 911 director for Cumberland County, and I'm personally against the mandate. I'll refrain from a professional view on that because I haven't checked with all of my business partners. I'm one of the PSAPs in the state of Maine. We currently employ 38 911 dispatchers. 15 of them are not vaccinated. Just to shed some light for folks that are making the decisions here, we fall under Maine EMS licensure because we provide emergency medical dispatch instructions to folks on the phone. Probably the best example I could give you is CPR instructions. Without this Maine EMS license, we hold a certification nationally. And the only difference for us is that Maine EMS gives us a blessing to use our national certification. My question is, what happens since we are nationally certified to provide CPR instructions and other maybe non-life threatening medical instructions to callers if Maine EMS tells us we can no longer perform that function minus the vaccine? What happens to a person in their liability of actually being trained in it but not being able to actually perform the function? I won't speak for other dispatch centers, but I think it's been pretty clear here that PSAP specifically, the difference between us and a dispatch center is that the 911 call comes to us. If the 911 call doesn't come to us, it's not going to get to all of these stories that we've heard. And ultimately, it's not going to get to the people that we're here to serve and protect. My center specifically has had 40 hours of downtime due to a COVID positive, and that was a vaccinated employee. All other downtime that we've experienced has been from, I would say, the red tape around COVID. keeping people home, sending them home because they have a symptom while we vet through to make sure that they don't have COVID and don't spread it to other employees. So our downtime for actual COVID has been 40 hours, and that was a vaccinated employee. I personally would ask the board to strongly consider not including dispatch if this goes through.
Thank you, Melinda. Justin Robash, next.
Morning, Chief. Can you hear me?
Yes, sir. You're all set. Go ahead.
Fantastic. First, let me thank the board for giving everybody an opportunity to voice their opinion. I think it's important and paramount that we do get the thoughts of everyone on this. I feel like we're at sort of a breaking point, I guess. A little bit about myself, career firefighter in the city of South Portland, per diem for 2 other departments. I'm an instructor for South Portland's drill school, Pasumpscot Valley Fire Academy, Tri-County Fire Academy, SMCC, South Portland E-Board member. I sit on multiple committees, including peer support, which I'm extremely passionate about. I've had 2 grandfathers that have fought in war, countless friends in the military, over 53,000 in combat deaths in World War I, over 290,000 combat deaths in World War II, over 47,000 combat deaths in Vietnam. Over 650,000 people have fought and died for my right to choose, and I am losing that right. I wear a mask to protect my patients. I put masks on my patients to protect me. I'm being told if I don't get a vaccination, I lose my job. I've worked 15 different jobs over 25 years and have finally found my purpose. I give and bleed to the fire department, and that's going to get ripped away from me. I think my last statement to you guys is there's an extreme what's the word I'm looking for? I guess people don't want this mandate. They think we all deserve the right to choose. I also stand with that statement. I think you guys have seen today the volume of people that are against the mandate, not necessarily the vaccine itself. And I find it very, very hard to believe that you guys can actually go forward with this without listening to the opposition. Chief, I thank you again for the ability for me to speak. Thank you.
Thank you, sir. Jared Blake, you're next, please.
Good morning, and thank you for allowing me this opportunity to speak. I'm a firefighter and an advanced EMT, as well as a fire chaplain. And I would like to express my opposition to this mandate that the governor has expressed upon us. We have seen since COVID has started a burden on our healthcare workers and first responders all across the state. Last year, we were hailed as heroes as we battled the front line. And now we have this mandate that we have to either comply with or lose our jobs. As a fire chaplain, assisting firefighters and EMS providers, not only in my home department, but others around me, I've seen increasingly amount of contacts from firefighters and EMS providers expressing their stress with the uncertainty that is upon them, whether they are going to lose their livelihoods or not. And I would just like to encourage the board to not mandate this. I understand that you folks really don't have that position, but encourage the governor to rescind this mandatory vaccination for our healthcare workers, as there's already a burden to the system. Thank you, folks, and have a good day.
Thank you. Sean iPhone is next, please.
Hey, good morning.
morning.
I am Sean Holzhauser. I'm an EMS provider, and I am vaccinated. I just wanted to say that I am in support of the mandate because I believe that a layered approach to the pandemic is the best way to fight it. Some of you may know that as the Swiss cheese model, that no one solution can be 100% effective. So I've heard questions today asking, why PPE only was sufficient protection last year before the vaccine, but not now. And I would submit that, we can't just do one thing. We can't just keep our apparatus disinfected. We can't just wear PPE. And we can't just get a vaccine. I think we need to be doing everything we can in the best interest of the public we serve. I'm disappointed to listen on the call this morning and hear a lot of political misinformation make its way into this discussion. As of this morning, the Pfizer drug is FDA approved. And yes, the vaccines were created fast, but that is because they were created without delays. And that is not the same thing as saying that they were rushed. For instance, enrollment of tens of thousands of patients for phase trials happened in 16 weeks, which is something that can take more than 2 years for a typical drug. We already have vaccine mandates for other diseases, whether it's for enrollment to attend school or employment. And I don't think adding the COVID vaccine to this list of other vaccine mandates should be any different. So I guess I just want to reiterate that I support the board. I support the mandate. I support including dispatchers because if an infection makes its way through a dispatch center, it's going to cause all the same manpower and response issues and 911 delays that many people have echoed this morning. It is my hope that the providers of Maine can set political and emotional feelings aside and rise to this occasion and be the professionals that the general public thinks that we are. Thank you.
Thank you. Bill Collins, you're next. Bill Collins, you're up next.
Good morning. Can you hear me now?
Yes, Ken, thank you.
Excellent. Thank you very much. My name is Bill Collins. I'm an EMS provider in Southern Maine. I worked for the city of South Portland for the past 30 years. I've been a paramedic for 25 plus or minus. I would like the board to follow the facts and the science. I've heard a lot of conjecture. I've heard a lot of, I think this is going to happen. I think this might happen. Follow the science. I can't say that enough. I am strongly in favor of this mandate. We have to take care of our patients first. We have to take care of ourselves. This is not only about force protection, but it's about taking care of our patients. I'm sorry you caught me. I just ran in, literally running, so I'm a little out of breath here. One of the things I can't say enough is that if we want to be treated as professionals, we have to take the responsibility of being professionals. This covers not only our actions towards ourselves, but to our patients and to protect our systems in entirety. I don't want to take a ton of time. I just want to say, follow the science. Thank you very much.
Thank you, Bill. Ben McKinney, you're up next, please.
Can you hear me okay?
Yes, all set. Go ahead.
Thanks for your time, Chief Libby and Maine EMS board. My name is Ben McKinney, licensed in EMT intermediate and advanced for over 20 years now, work in Western Maine. Started in high school as a EMT and worked professionally in the system. In regards to this mandate, I am 100% opposed to it. The Maine EMS board, as well as yourself, received a letter indicating my stance on this particular issue. And one of the highlights of that letter was we were able to give patients the right to choose what kind of treatments they get, and they can refuse them. And I think it feels like it's a double standard, not allowing patients or us to make the right to choose. That's one part. The second part is I don't know if this was a advertised declaration, but in talking with several state representatives, I was told that on June 30th, Governor Mills ended the civil state of emergency. And on the same day, DHHS filed for a public health state of emergency. And at last I knew, I had not received any email stating that. And I would like clarification when it comes to the question time, whether that was advertised or not, that we were actually in a public health state of emergency at that time. And that is on the DHHS website for anybody to view. The other issue is that when they talk about staffing, especially here in Western Maine, rural Maine, if this mandate goes through, we're excluding several groups of people that could or would be or already are involved in public service, and that would be the homeschooling folks as well as the Amish and Mennonite. There's been a good influx of Amish and Mennonite folk in the state of Maine, especially up here in Western Maine, and they don't believe in vaccinations. So that would exclude that community. The Maine EMS, I feel, has the right to right the ship, and I think they need to really, really think about this mandate. And like I said, I am very much opposed to this. Thanks for your time.
Thank you, Ben. Robert Courier, please.
Well, I would have liked to speak, but I got a call. So thanks for calling on me.
Okay, sir. Thank you. Michael Thurlow, you're next then.
Good morning, Chief. Thank you for running a tight ship, and thank you to the board members for their marathon session and giving everybody the opportunity to speak. I personally believe in and am fully vaccinated, but I do want to go on the record as opposed to the mandate. I'm speaking both professionally and for my organization. A large percentage of our organization is vaccinated, but I am very much concerned for the system itself and very much concerned for our PSAP because a larger percentage of our EMD folks have chosen not to be vaccinated. And I think there's been plenty of testimony so far in that same vein. The dispatch centers are particularly vulnerable due to staffing shortages that already exist, and this will absolutely negatively impact the entire fire and EMS operations for some time to come. There just aren't candidates out there. So my primary concern is the short notice, and because of the technical issues last week and the fact that this needed to be postponed a week, and a previous speaker already spoke to the timeframes. I think the most important action that the board could take is some kind of a request to delay the implementation, at least to give us a chance to get this fully vetted and give folks time to change their minds and get vaccinated without having to be terminated in such a short period of time. We've got 80 days in this rulemaking process. It seems like there should be some middle ground there where we're able to postpone this very short notice piece. I also support alternatives like PPE and testing that have been brought up. I don't want to rehash things that have already been said. I do have a few questions. As have been asked by others, I am really interested in how this applies to non-EMS licensed personnel. We have a number a percentage of our folks that are not licensed, who are firefighters. As an agency, if I'm an EMS agency, and particularly not only at the state level, but I am concerned, as one of the other speakers mentioned, at the federal level, as an agency, are my non-EMS licensed personnel going to put me in jeopardy for Medicare funding and any of those issues? My second question is, what does enforcement action look like? Is this strictly the provider's license that is on the line and theirs, or are there in fact employers that are going to be subject to enforcement action of some kind? And the third question or semi-question statement is, I agree with what Lori from United mentioned earlier about the cost of compliance. There's a long list of vaccinations on that emergency rule. I understand that COVID-19 is the current topic of discussion, but there's a dozen other ones on there. Our organizations like us that we employ almost 200 people altogether between our call, per diem, and career staff. Are we going to be on the hook for all those vaccines and the titer testing and all the other things that go with that if this is extended? This is just step one in what could be going forward. So just to summarize, I would appreciate any attempt to delay implementation. I'd like to consider alternatives, and I do very much respect Dr. Shah, the work of Maine EMS, Commissioner Sawchuk, everybody that's been working as hard as they have throughout this pandemic to keep the services in our state safe. I think this was a well-intended policy, but certainly short-sighted due to the very real unintended consequences that I think everybody really clearly articulated today. So please give us a little bit of time and please seriously consider exempting the EMD folks. They're not going to harm anybody in the public. They're working on the phone, and it just seems like an unnecessary step that is absolutely going to cripple the SIPs. Thank you, Chief.
Thank you, sir. Alex Johnson, please.
Hi, Chief. Can you hear me?
Yes, sir. Good to go.
Okay. So first off, I would like to say that I am definitely against the mandate. But as like everybody else has said on here, that, we all have a right to choose. And that's the big thing, is that we need to be able to choose whether we want it or don't want it. And for bigger entities to speak out for us and say that they're for it or against it really shouldn't be what we're putting out there. It should be the people that are actually making this decision. Being in this career, EMS, fire, hazmat, police, we're all brothers and sisters. And I think, as you guys can see today, that there is a large number of us that are taking this extremely seriously and looking at losing our careers, looking at losing, positions and everything that we stood for because higher politicians and people decided that this is what is going to be done. And obviously that is not the right path to be taken. We were given an extremely short amount of time to be able to try and figure this stuff out as family members and stuff, to say whether or not, we can financially afford to quit our jobs because of this or resign because of this. With that being said, I do have a couple questions about, first off, if, we do get these vaccines and the people do decide to stay, who's going to be responsible for now if we get sick, now that this is a mandated thing? If we get sick, does this fall under a workman's comp issue? Who's going to pay for our sick time? Is this going to be state? Is this going to be held at the departments levels, private service levels that, who are some or most of them are on our side against the mandate? Second thing is also, now that we also have heard that the legislative document 867, if that goes through, that is going to push back mandates up to 5 years for safety testing. So forcing these people to get stuff to get these vaccines before even this legislative document has been looked at. If it goes through and everybody has now been vaccinated, I mean, I see a lot of lawsuits happening, or people coming out once again disgruntled because they were forced on something that they potentially could have waited 5 years to make this decision. So again, I hope Maine EMS makes the right decision and takes all these accounts very seriously, that, we the people are very against this, not necessarily against the vaccine, but that we need to band together and be able to say no for those reasons, that we the people want to we want our choice. But besides that, that's all I have. Thank you very much. And again, I hope you guys listen to everything.
Thank you, sir. Appreciate it. Matt Albright.
All right, can you hear me?
Yes, all set. Go ahead.
Beautiful. I'm standing in an airport, so if things get loud and crazy, I apologize in advance. My name is Matt Albrecht. I'm the union president for the South Walton Professional Firefighters, IFF Local 1476. I'm here right now speaking on their behalf to ensure that every single one of their voice is heard as well. Our department is estimated to be over 90% vaccinated. And after this mandate came out, I submitted a survey to all members in which over 66% of the members who responded were against the mandate. 50% of the members are unsure or unwilling to take a booster, which leads me to one of my questions and how the booster is going to be included in this. And I apologize if that question was already asked. I think more surprising was when I saw that 25% of our members are okay with and or willing to accept termination before they allow the state to mandate them to do something that they're unwilling to do. That's a quarter of the department. That's taking a shift off duty, essentially only responding to calls 3 out of 4 days as opposed to every single day. And of course, all of us are there to fill that void. This does seem to be happening very fast. I think this is the fastest I've seen Maine EMS work or act. And I think if everybody is truly there for the betterment of the providers, I'd like to know also what Maine EMS has planned for the other epidemics that we are suffering from. Mental health, drug abuse, alcohol addiction, all which has, as the science says, been proven to be diseases that we suffer from, as well as obesity and cardiac disease from not being able to take a moment to have a healthy, well-balanced meal while rushing from call to call to call. These are all other epidemics that are plaguing us and killing our members more than COVID is. And I'm interested if Maine EMS or the state has any plans to help us and help our members with that. Thank you.
Thank you, Matt. Robert Courier, please.
All right, I'm back for now. So my name is Robert Courier, a firefighter and paramedic for the city of Augusta. I am representing myself, and my views are my own and do not represent the city of Augusta's viewpoint on this mandate. I just wanted out there that I am a vaccinated individual. However, I am opposed to this mandate. One thing that this mandate does not consider is an individual's right to religious exemptions. It completely takes that off of the table and is making it so the provider cannot choose for themselves. The current timeline that was given to us of October 1st is not flexible whatsoever. It was given to us and was a big slap into the providers' faces and said, you need to get this or you need to lose your livelihoods. Some, if not most of the providers are concerned about this mandate solely because it's taking away their livelihood or the government is forcing them to take a vaccine that is now just FDA approved as of today, or have everything that you've worked for taken away. I would encourage the board to let the decision remain in the provider's hands, much more like we allow our patients to choose what care they receive. Proper PPE utilization has proven during the pandemic that it can decrease the chances of providers becoming sick, both in and out of the hospital and pre-hospital setting. I would like to see Maine CDC and Maine EMS come up with a statistic of some sort that shows any data saying that there have been infections of patients due to providers being unvaccinated or sick providers working in the back of the ambulance. Thank you very much for your time. I appreciate your guys' hard work that you're putting into this, and please take into consideration the amount of people that are opposed to this today, and making sure that we are not as shorthanded as we are now. Thank you.
Thank you, Mr. Courier. Next is conference. If you could unmute and identify, that'd be great.
Can you hear me, Chief?
Yes.
My name is Adam Keene. I am a service director for two small rescues. One's the town of Mercer, the other's the town of Norwalk. I am in favor of the vaccine myself. I am vaccinated. However, I am immensely in favor of the right to choose. Like many people have said, I'm just going to reiterate, it's your body, your choice. I also believe that's part of the constitutional right, being human. I know this may sound a little off. However, I feel with the mandate of this magnitude would be like me placing a patient in protective custody that is alert oriented ×4. It also has decision-making capabilities. You know, we're all alert oriented. We have decision-making capabilities, hence we do it for our patients on a daily basis. I think as individuals, we need to be able to make those decisions on our own, not be forced upon by the government. With that being said, I would strongly encourage the board to table a decision on this until further investigation is done, as well as, you know, listening to everybody today and conferencing with each other to make an appropriate decision moving forward. I do support the board in their actions. I just would like them to be done in a manner that's the best case scenario for all of our providers as well as our patients. First day of firefighter 1 school, you're taught to take care of yourself before anybody else. As if you can't take care of yourself, you're not going to be able to take care of your partner or your patients. I think we need to remember that. So again, I strongly urge the board to table this till a later date before you make a decision. That way you can be as informed as possible. And ultimately, we don't know the long-term effects of this vaccine, and we won't for a long time to come, unfortunately. Thank you for the time, Chief. Appreciate it.
Thank you, Chief. Next up is R.H. Whittam or Witham.
Hi, this is Mike Larson, actually in for Becky. I was having a little bit of trouble on my own laptop.
Oh, okay. Go ahead, Mr.
I'm
Larson.
the Chief of Three Rivers Ambulance Service in Milo, and I represent. My thoughts are my own, not representing the service. In about 5 weeks, I'm going to lose half my staff. Same with everybody else. I'm going to lose a whole lot of people, a lot of good people. I'm going to lose half my office staff too. And I think this is ridiculous that 6 months ago, 7 months ago, you have a vaccine that comes out that gets approved. And then the 65%, the Johnson & Johnson in January was 65%. Less than a week later, Fauci is getting on there saying, oh no, it's wrong, it's 95. And everybody is saying is trust the science, trust the science. Your science is changing every day. So what do you need to trust? And that's my concern, is everybody's trying to push this vaccination and trust the science when the science is changing. I am for choosing whether or not to take the vaccine. I'm against this mandate. And I hope that the board pushes for that. But I kind of feel like we're pushing rope here. Thanks.
Thank you, Chief. Jonathan Powers, you're next.
Good morning.
Good morning.
Appreciate the opportunity to speak. I stand fully vaccinated. I support the science. I appreciate Chief Turcotte's data. I truly believe in all those numbers and echo everything that he brought from the data. As I said, I stood beside all of my staff proudly to be on the front line to end this. I supported all of my staff that made the decision to be vaccinated. And I do still believe that vaccinations are our only defense, like there are with so many other diseases. I also support a mandate, but administratively, I don't support this mandate. I truly believe the CDC has overstepped their authority to force this onto EMS without understanding the untoward effects that it will have on our system, not necessarily from a staffing standpoint, but just a broad reach of this mandate requiring that all contractors, so does that mean my billing agency that isn't even in the state, have to be fully vaccinated because they recognize a contractor as an employee? These definitions are just so broad that I really don't think we took the time to think about the far reach of this. I do fully support a mandate. When we got into this career, we all had to show proof of our vaccinations that we all received when we were 2, 3, 4, and 5. And agreeing with Mr. Collins that if we want to be professionals and act like, treated like professionals, we need to act like professionals. And I think the board, and my recommendation to the board was that we send a resolution to the CDC recognizing their desire and appreciate what they were attempting to do. But I think the board really needs to step back from an emergency rulemaking stance and go into formal rulemaking. We should have rules requiring mandated vaccinations. We all stand behind having our hepatitis shots and mumps, MMR, all these other vaccinations, but our rules don't require those. And I may be wrong on that, but my understanding is we don't require it, which also means that none of our reciprocities are required to have that. So if they're coming from another state that doesn't require vaccinations and they were able to go through their education without those vaccinations, we have folks here that may be working in EMS that have no vaccinations. So I think that's a bigger issue than just the COVID-19 vaccination. And I think we should go step back, take this a little slower, go into formal rulemaking and look at our vaccinations as a whole to truly go towards the professional side of things. I think we should have something that echoes or mirrors the CDC's rules and DLR's rules around vaccination for staff so that folks coming into the profession have that up front and understand it. I think the timing of this is just really off. As I said, I do support vaccination, stand behind it 100%. I agree with some type of a mandate for the profession so that we're protecting our, if nothing else, force protection as well as for the public. And really think this should be out of emergency rulemaking and more into a formal process. Thank you for your time.
Thank you, John. Joshua Perry, you're in line.
Hey, thanks, Chief. I work for the city of South Portland, but this does not represent them. This is just my own personal views. So we're here to trust the science and to force this mandate. Then this is to protect our patients. But whether we're vaccinated or unvaccinated, you can still carry and spread the disease. But then we're also here that, well, it's to protect me. That's why the city's provided me with Envo mask and all the proper PPE. So that's my personal choice. With the vaccine, it sounds more like a medical treatment because I can still spread it and I can still receive it, but now I need a booster shot. So that's definitely one of my concerns. We're told this is to keep us safe so we're able to respond to the other people, but when this collapses, because the city's going to be forced or towns are going to be forced to lay these people off, what's that really doing to the system? I would highly encourage people not to quit their jobs. Put this force on the cities and towns to lay you off or to fire you. So don't quit. I don't really understand how I'm putting our patients at risk when I'm properly protected. I go on EMS calls with a lot of the police department who don't wear masks. We wear masks on every single call. Are the PD going to be mandated to wear this as well? They don't even wear masks where we have to on every single call. I I think myself as a provider, I definitely advocate for my patients as best as I can. We have a protocol for transport and no transport. Oftentimes I have to call online medical control and have them speak to the patients. I've definitely had people that I really wish that they went to the hospital, but that was their choice. I have definitely, if they look at the protocol, I, as a person, fit all that criteria. If there's a waiver you want me to sign, refusing this vaccine, I'll definitely sign it. I think I should be afforded the same rights as a patient about my medical decision. That's all I have. Thank you.
Thank you, Mr. Perry. Greg Hamilton, you're up.
Thanks very much, Chief. Can you hear me okay?
Yes, loud and clear, sir.
Thanks. To you and the commissioner and everyone else, I'll try not to be redundant. I just wanted to chime in and let you know that the, pardon the siren in the background as well. I found out kind of by accident that the folks on the EMS side were required to have vaccines all along. And when the governor made her announcement last week, I went in to see my colleagues who are steps away, the fire chief who spoke earlier. And shame on me for not knowing this, but as EMDs, I guess we're going to have to be required to do this going forward. But in the city of Westbrook here, we're looking at a potential 30% loss going forward. So I think you've already heard that from a couple of other PSAPs. So I'm fearful for what this mandate was going to do for the 911 system. And the other thing that's been bothering me is this is for 16% of what my center does. So on a daily basis, we do 16% of our calls are fire and EMS related. The other is 84% is law enforcement. So every day we're taking care of the police officers too. So here in Westbrook, it's kind of a family. It's law enforcement, it's fire and EMS. So for a very small percentage of what we're doing, this licensing that we have to do, it's kind of a hard pill to swallow. So that's my 2 cents. I'll shut up so others can talk. Thanks very much.
Thank you, Greg. We've got 4 in the queue. Once we're through those 4, unless the board has any objection, I'll plan for a break after that. That being said, the next will be Kevin LeCaptain, please.
My name is Kevin LeCaptain. I'm representing myself. I do oppose this mandate, and I had many questions that have already been asked. I feel Maine EMS needs to address the concerns with the CDC. I do want to draw my attention to in Maine EMS rule subsection 3 in regards to exemptions versus the CDC rule of subsection 6. The CDC states that for COVID-19, any person is not immunized or immune must be excluded from the work site without evidence of immunity. If the CDC provides the direction to Maine EMS, it determines that if Maine EMS can be more lenient than the CDC with the exempt persons by only testing for infection with a test that's been questioned as to its reliability. I just want to thank you for your time.
Thank you, sir. Mike Norton, you're next, please.
Good morning. Can you hear me?
Yes, loud and clear. Then you're muted. Try one more time, Mike.
Sorry about that.
There you go.
Glad for the opportunity to speak, and I applaud everybody that's done so. I have 2 thoughts or questions, depending on how you read them. One is for those of us that do stay strong on Judgment Day and are strong with our beliefs and get terminated eventually. Are we going to be eligible for unemployment? Are we going to be eligible to maintain our benefits for ourselves and our families? The second is time. We've heard about the science, but that back end of the science is not there yet. A lot of numbers have been vaccinated, but time has not passed. We don't know what the future is going to bring, what effects are going to be relevant, what's going to be seen and how it's going to be affected, and who's going to pay for it. The other thing is time for people to follow the process digest all this data, digest the science, and make the decision that's best for them. Thank you.
Thank you, sir. Look to the board for your pleasure. We've got 4 in the queue right now. We're a little over 3 hours going. I'd like to take, I would say, a 20-minute break. What's your thoughts? Yeah, who I didn't see who called.
Dennis Russell.
Dennis, go ahead.
I would support a 20-minute break, coming back and listening to those in the queue and whoever else we need to.
Okay. With that, we'll take a 20-minute break. And if the board members could turn your cameras off and then turn them back on when you return. And those folks that are still online will be back in just a few minutes.
You're good to go.
Okay. Thank you, everybody. Needed a quick recharge. And in the words of Joe Kellner, bio break. So welcome back to the emergency board meeting. We're going to resume our public comment period. We have 7 people in the queue, and we're going to start with Amanda Bessie. You're up, please.
Hey, good afternoon.
Hi, Amanda. Go ahead.
So my name's Amanda Bessie. I've been working in EMS for 13 years. It's actually my part-time job, as I work 48 to 60 hours as my part-time job. My full-time job is I'm actually a clinical laboratory tech. So to say that COVID has been in my life since October of 2019 would be putting it mildly. As far as my opinion, I am pro-vaccination. I do recommend the vaccination. However, I think this mandate is too quick and off the ball. I don't feel that this has given us an actual enough time to decide whether providers want to have this shot or not. Because a lot of the complaints we're hearing is that they don't know the long-term effects. And I feel that this having the October 1st date just doesn't allow them to actually have that time to go through, have the conversations with their families, do that sort of thing. Just as if it's almost like you told a cancer patient, hey, you have 48 hours to choose what your treatment is. You know, you wouldn't do that. They have to go through and have these types of conversations. To piggyback off of all my other staff and other people that have mentioned about the short staffing, we are going to lose office staff just because they withdraw a paycheck from healthcare. Which I think is kind of ridiculous. They'd have no patient contact whatsoever, and we're going to lose half of our office staff. We're after this mandate, we're probably going to be down to about 5 staff members. That's covering about 5,000 people in a 500 square foot area. We've kind of been short staffed for quite a few years and kind of ranking on that edge of being burnt out. And I think this is just going to exacerbate that immensely. I care very much for my community. And I've been born and raised in EMS, which is why I do it. And I just feel like that this is going to be, I know absolutely patient care, but I feel like this is going to be a disservice to my patient care because it's causing us to be so short staffed that we are not going to have the proper care for our patients. That's all I have to say.
Thank you, Amanda. Stephen Quinn, please.
Hello, can you hear me?
Yes, sir. You're all set.
All right. Just thank you for taking the time today to listen to public comment. My name is Stephen Quinn. I'm a firefighter paramedic in Southern Maine. I would just like some clarification on if a positive antibody test for COVID-19 will be acceptable proof of serological immunity, and if proof of immunity will be accepted in place of vaccination against COVID-19. And if not, I would like the board to consider advocating for a positive antibody test result as acceptable proof of protection against COVID-19 for individuals who are not vaccinated. If the intent of vaccination is to build antibodies, it's logical then that a positive antibody test be accepted as proof of protection against COVID-19, regardless of the way in which those antibodies were acquired. Thank you.
Thank you, Mr. Quinn. John McLeod, you're up.
Hi, I want to thank everybody for the opportunity to speak here today. And I also just wanted to express my appreciation for the format and the availability to, place comment. You'll have to excuse me if I stop or pause. I'm a little nervous just because I'm ill prepared to speak here, but I felt it important. I'm the vice chair of the Wells Select Board. I'm not here representing the town or the town of Wells. These thoughts and opinions are mine and only mine, but I felt it important that an elected official put their 2 cents in on this. A lot of good points have been made here today about the actual vaccine, about, the understaffing in the EMS world. These are things that we're very familiar with. We all talk about it frequently. Each one of our communities has contended with this time and time again. Recently, we hired a new fire chief, and I was able to immerse myself sort of in this world and learn quite a bit about it from that whole process, both from the chief after hiring him, the interview process, and from our guys on the ground. My concerns today are strictly on principle and ethics. Civil liberties and rights are no small deal in this country. And I've heard a couple of arguments say that, it's not a violation of these people's rights. It's just a condition of their employment. Well, to me, when you threaten someone's livelihood and their job, that's a violation of their rights. Under many other circumstances in this country, if an employer did that, they would be held with their feet to the fire, and they would be taken to task on that and over that. Frequently, we like to hear elected officials come out and they want union support or they want the support of our first responders. But to me, what I've been watching through this is we have a section of this group that is struggling. I mean, mentally, this is stressful, not knowing where this is going. And I'm really disappointed in the way that it's gone, and that when these people need us, I'm glad that this board's taking it up, but I've seen some failings from what I've seen overall to really take this cause up and have an honest discussion. This country, we have systems and processes in place in this country by which we have governed that have made this country the greatest on earth. A respect for individual liberty and the voice of the people over unelected rule has driven America since its founding. And I think that throughout this conversation, that we need to keep that in mind. Today it's EMS providers. Tomorrow it's going to be another group of people, and we really need some common sense to prevail from this. And whether that's PPE and testing, I really think this draconian measure that's being taken today is a disservice to not only the EMS providers in this state, but also to its citizens and the population of the state of Maine and the United States of America. That'll be it. And I thank you again for the opportunity to speak.
Thank you, Mr. McLeod. Mike Robitaille.
Good morning, Chief. Can you hear me?
Yes, good to go.
Thank you. So I'd like to just say that there's been a lot of great information that's been out here today. And one of the questions I have or comments is I'm curious how many complaints that the Maine EMS board has handled in regards to staff not wearing the appropriate PPE, and what type of interventions have been taken by the Maine EMS board for disciplinary actions to those people. Daily, we receive, as chiefs of services, we receive information about our staff when they've been in contact with COVID patients and the PPE that they're wearing. So there is a tracking system already in place that Maine EMS is able to monitor. So I think that we already have a checks and balance in there. I'm in favor of the vaccination personally. I'm not in favor of the mandate. It is going to affect my agency. 20% of my full-time staff will resign, and that is a hit for a small organization. I'm curious also to what types of plans or Plan B has been put into place or will be put into place when portions of our state cannot respond to EMS calls of service because their agencies have been shut down. The first responder services have been closed because they don't have staff that want to respond. We talked the California wildfires and the mobilization of mutual aid. I'm not sure that we in Maine are prepared to do something like that for EMS agencies. I can't send my staff to northern Maine. I currently have 3 islands that I'm responsible for. And if those first responder services shut down, then my primary services will have to go to those communities potentially, which is an hour to an hour and a half round trip. So I'm just curious to find out what Maine EMS is looking at for a plan B on a statewide mutual aid, a mobilization process for mutual aid also. I'd like to thank you. I appreciate the time and thank you.
Thank you, Chief. Maggie Johnson, you're up next.
Hi, actually, my name is Sherry Johnson.
Hi, Sherry.
Hi, I'm just a concerned Maine resident.
Okay.
I feel our rights, our freedom, of choice is definitely, at risk. I think we've been misinformed about the actual number of actual COVID related deaths. I think those numbers have been skewed. I think we've been have had misinformation on the effectiveness of the vaccine. A lot of people are vaccinated that are getting COVID. We've had misinformation on the actual reported adverse reactions and deaths due to the vaccine. I have known people that have caught COVID, and many of them only knew because of where they worked. They had to be tested and they had no symptoms. And one person did pass away, but they were in poor health. And the other, there were a few that were very sick, but the majority of the people I have known didn't even realize they had COVID. So I believe we have just been misled on a lot of information. And I think we need the truth in order to make the right choice for us. I'm not necessarily against a vaccine. I'm against the mandate for sure. And I believe, and most important, the American people's right, the freedom to choose. And that's about it. Thank you.
Thank you, Ms. Johnson. Appreciate it.
Thank you.
Hey, you're welcome. Dave Kelly, you're up.
Yes, hi.
Hi, Dave.
My name is David Kelly, firefighter for the city of South Portland. These are my views and not the views of my organization. If this mandate is to protect me and my patient, then why is it that police who routinely respond to EMS calls are not also mandated? So are they not able to spread COVID? You want us to trust the science, but the science has been changing almost daily. What is the end goal here? So we're going to start to say no to the medical service to unvaccinated patients. And I guess the biggest thing, so now you're trying to include the dispatchers who don't have any patient contact, but at the same time, we're saying that it's to protect the patients, and dispatchers have no contact with patients. Whether we're vaccinated or not, we can still spread it. So I just don't understand the reasoning behind this. When if I'm vaccinated, I can still spread it to my patient. So what's the difference? Thank you.
Thank you, Mr. Kelly. M. Kraus at IFF.org. You're up.
Thank you, Chief.
Yes, sir.
Good afternoon. My name is Michael Kraus, and I'm the president of the Professional Firefighters of Maine, representing Maine's career professional firefighters, EMTs, dispatchers, and paramedics. I'd like to first thank those that have previously spoken against the mandate, and the PFFM supports most, if not all, those concerns and the issues that they've raised. The Professional Firefighters of Maine strongly encourages and recommends that all of our first responders and our members receive the COVID vaccine to prevent the spread of disease and to continue assisting in the administration of vaccines in jurisdictions where appropriate measures are taken to protect our members' health and safety and their rights on the job when vaccinations are being administered. There's no doubt that the EMS personnel and essential workers responsible for the health and safety of our families, patients, and communities. And our members have been and are willing to be on the front lines every day for the people that we protect and serve, no matter what the 911 emergency is or the pandemics that we may be facing. Being vaccinated is a professional ethical obligation to be considered by the providers and not the government or our employees. The PFFM Maine has to oppose the Mills administration's efforts to require healthcare workers and EMS organizations to be fully vaccinated against COVID-19 by October 1st, and their methodology in which this requirement has been mandated and attempting to be implemented. The Professional Firefighters of Maine have raised some legal issues with respect to the methodology in which the CDC has mandated this rule. We've provided those concerns in writing to them through the appropriate administrative channels, and I believe your general counsel has a copy of them, and I won't regurgitate those here today. In addition, I am not going to repeat all of the oppositions previously stated by our city or town managers, our fire chiefs, our medical directors, some of my union officers, as well as many EMS practitioners throughout the state have professionally articulated their concerns and issues and solutions. However, one issue that was not necessarily addressed as a result of the mandate on the COVID vaccine was the impact that this mandate was going to have on the labor relations process at the local level, as our employers attempted to implement the rule that has more questions than answers, as well as our local union officers have to work to fully fulfill their representational responsibilities on behalf of the employees they represent. The mandate and the time frame provided for the implementation will no doubt create employment issues that will need to be addressed and will be costly, time consuming, and as some have stated today, impacting on the service as a whole. However, with that said, the Maine EMS Board of Directors has the opportunity today to put the genie back in the bottle and develop and publish a Maine EMS rule that addresses the concerns raised today, reduce and or eliminate the adverse impact the mandate will have on the workforce, prevent any additional work-related stress, and have an immunization program that is developed through the normal rulemaking process and not mandated, and have the necessary exemptions built in and workarounds necessary to provide our departments and practitioners the protocols necessary to continue taking care of themselves and the citizens they protect and serve. Protocols like requiring the N95 mask, the PPEs, distancing, and weekly testing are not unreasonable protocols to be considered in lieu of mandatory testing like federal and other state and local governments have done in recent days. This and other concerns and options presented needs to be seriously considered by the board, and the Maine EMS rule for COVID vaccines should reflect these solutions. My organization and our leadership and members, we stand ready to work with you to address the concerns raised today and to develop Maine EMS rules for COVID-related vaccines. Thank you for the time, Chief.
Thank you, Mr. Kraus. I have two remaining, both have spoken already. If there's anybody that has not spoken yet that wishes to. Okay, with that, I will go to Mr. Kaye and then Ms. Kluge quickly, please.
All right. I'd like to say thank you for letting me speak again. This is going to be pretty short and sweet. The other day, the Maine Fire Chiefs Forum sent out a letter in response to all this, and I had a reply to all the Maine Fire Chiefs in the state.
I'll save you the boring NREMT question that I made up over it, but it basically talks about a patient with a third-degree heart block that knows the risks and consequences of refusing transport and treatment from our EMS agency. And even with contacting online medical control, she refuses transport. Under that, a patient without decision-making capacity would be one who has one or more of the following: an altered mental status, intoxicated, confused, delirious, psychotic, comatose, unable to understand the language, or is a minor. I believe everyone in the state of Maine that holds an EMS license has all of those, and they are able to have decision-making capacity per state protocol, which is out of transport protocol in the gray section of our protocol book. Additionally, the service is expected to review all patient sign-offs through the service quality assurance mechanism. Patient medical records must be completed for all of these interactions and must include the following information. Is the patient calm, confident, sober, and alert with the absence of any acute medical, surgical, or traumatic process that impairs the patient's decision-making capacity? Greater than 18 years old, emancipated, or contact with a guardian. Services offered. Reasons services declined. Statement of risk and patient understanding of risks and consequences. Discussion of alternative services offered and potential consequences of declining offered services. And then a discussion with the patient that EMS services may be assessed at any time and the patient has a decision-making capacity. I believe all those things have been offered to our people, that we are all over the age of 18. We all are competent in decision-making capacity, and we have all been offered the vaccine. If we wish to take it, we can. If we change our mind later on, we can still take it. I would like to also go back to Sherry, her comment about the misinformation and some of that. Over the last week, Androscoggin County has had a drop of 36.9% in COVID cases. I believe that speaks volumes to what's happening. So I would ask that through Maine EMS, you are going to be our advocates, because we are patient advocates and we can't advocate as much for ourselves as a board of directors are able to advocate for us. I want to thank you all for your time, and I hope you guys can take everything you've learned from all of us today and see the ramifications if you stick by with the CDC recommendations on this mandated vaccine.
Thank you. Jane, if you have something quickly to add.
Hi, my name is Justin LaDolce. I'm using my wife's account. No relation to the previous Jane. I know it's a little ironic.
It is. Thank you.
Yeah.
Go ahead.
I'm the fire chief down in Georgetown, and I just want to reiterate a lot of the things that people have said today. I find hold true to my situation as well. I think most of us here know how difficult it is to run a volunteer ambulance service. Finding volunteers, recruitment intention is one of the utmost priorities of any organization, but especially how hard our volunteers have been impacted, not just by COVID-19, but the cultural changes in volunteerism as well. I recall a full-page Portland Press Herald spread prior to the pandemic of Maine EMS, on critical teetering point, borderline collapse. That was pre-pandemic. And so, here we are, and we're looking at forcing potential volunteers, current volunteers, in the middle of a pandemic to choose between bodily autonomy and their career, their volunteerism, their community, their service. I chose to get vaccinated because I believed it was the right thing to do. I looked at the data and I made that decision for myself. I, as a service chief, I can't order somebody to do that. I can't order somebody to put something into their body against their consent, by holding their identity over their head. I don't believe that's right. And, I echo previous sentiments earlier, fundamentally, that is un-American. We have a duty to hear all voices. And I think, there's been a consensus here. And I hope the board does choose to represent the needs of our, services, service directors, providers, and find an equitable solution to this. Because, again, I do fully support the vaccine, and I But at the same time, this concerns me that we've created such a divisive issue about getting the vaccine. I can't imagine how many providers here would have been in favor of getting it who are now turned off because they see a government mandate forcing them, and that this has become a whole entire separate issue. So moving forward, this hits at all levels: recruitment, retention, budget, administrative needs, more unfunded state mandates. It's harder and harder to run an EMS service. And, small services especially look towards Maine EMS and the board of directors to help facilitate that process. And this whole mandate, the way it was done, the way it was rolled out, I haven't seen numbers. I haven't seen numbers of EMS providers infecting patients. I haven't seen data that shows that our PPE is ineffective. We've been doing this a year and a half, and I believe, in my experience professionally working as a paramedic in Maine, we have done a good job. So show me the data. Thank you all for your time, and let me speak. I wish you have a good afternoon.
Thank you, Chief. Abigail McMahon is our last one.
Hi there, my name is Abigail McMahon and I work for Yarmouth. I'm representing myself and myself only. I just want to take a moment to say that this is completely going to affect my ability to make a living. Here I am weeks away from light duty as I'm pregnant, and I'm being told that even as a provider that would be on light duty, I can't take light duty because I have to have the vaccine to still be employed by my employer. So not only am I being forced into a vaccine, I'm now being forced into a vaccine as a pregnant mother. I hope that you guys will at least try to see if you can mandate masks, PPE, appropriate testing instead of the vaccine, the mandated vaccine. Another thing is you all have this medical waiver form, but as I can understand it, we don't have any practicing providers that are willing to even write those waivers. So there's really no option for us as providers, and I'm hoping that you guys can find some common ground here. Thank you.
Thank you, Abigail. There is no further public comment impending, so we will close the public comment. And we will move to the next item on the agenda, which is under new business. And it is a Maine CDC emergency rule change regarding immunizations. I will open it up to the board. As mentioned earlier, we have a couple of options, and those would be to do a resolution of any sort that the board desires. We have an emergency rule that has been drafted at request of the AAG for us to work off as a skeleton and build from if we so choose, or we simply acknowledge the vaccine mandate and close the meeting. So with that, I'll open it up to the board.
Chair Libby?
Yes, just if you could identify yourself, I can't.
Scott, it's Scott Susi.
Scott, go ahead, thank you.
I think as a board, we have to take some actions, but I think we really need to define the content of what's here. I don't think this is what was written is acceptable. There's too many gray areas in it for any service to be able to work with this. And seeing from the testimony that we have today from the general public, I have 65 no's, 7 yeses, and 6 either yes or no, all with great points, but most all the testimony came with questions. And I think as a board, our responsible act is to answer some of these questions in this resolution and not pass it as presented.
Scott, and you're referring to the draft rule that was sent out?
Correct.
Okay.
Correct, sorry. Yes, the one that was sent out.
I have a question about that, just for clarification. This is Joe, sorry.
Go ahead, Joe.
So if we adopt a rule, an emergency rule, can't the governor or whoever, the CDC, override out that rule with this?
I would look to Ron, and depending on the board's pleasure, we may want to do a quick executive session to review those options.
Well, let me answer the question obliquely, but if we do get much further, I'd suggest you might have a parking lot for questions like that. Instead of going in and out of executive session, we could trap some of those. But anyways, let me try to answer that obliquely. So I think what I heard the question is, if the board, emergency medicine board, and when they say this, I think you're talking about the draft EMS rule. Whether or not that could be overruled, I think by some other agency. So let me, your authority is clearly within the statute. You set the rules and standards for the provision of EMS in the state. Whether or not somebody would, and when I say somebody, another agency or the regulated entity would challenge those rules, that's a decision that they would make. If you adopt a rule, we would go to court and we would defend the rule. So your authority is to pass a rule. And I know there's maybe a little bit of confusion. DHHS passed a rule. And, our job is not to amend or to weigh in on their rule. Just to be clear about that. So it is possible, and I think you'll see occasionally in your world, where you have multiple agencies who have jurisdiction and multiple agencies who would have, set forward rules to comply. So I don't know if that directly answers your question, whether or not somebody would challenge the rule. This board needs to decide whether or not you, ultimately, whether you need a rule. There are advantages for having a rule for the regulated public and for the EMS board. With that, if we get much deeper in terms of, specific entities challenging EMS board's rule, then I would like to defer that to executive session. With that, I'll turn it over, Chair.
Joe, does that answer your question?
Vaguely. I'll save it. I'm sure there'll be an opportunity to speak up again. Thank you.
Sure.
Chair, this is Amy Drinkwater.
Amy, go ahead.
Yeah, I mean, with everything today and with what Scott said, I really think we need to do something. I mean, I'm over 100 between emails and what everybody said today, and like most of them are for vaccines, but also not for the mandate. So we've kind of drafted this. You've seen this that AG has done. I mean, if somebody wants to change some of this or go with it, this could be our emergency rule. If we have time, if people want to look at it to change it. But I do think we need to do something today, which then helps EMS as a whole. I mean, I think this rule is somewhat what some people want, but with a lot of questions. How's that?
Mm-hmm. I also think it answers some of the questions that have been brought up today and provides a little bit of clarity on who it applies to and when, which were several of the points that have been brought up. And again, as Amy mentioned, that certainly has the ability for us to tweak that as we go. And certainly if we pass rule, then that's what we would be tasked with enforcing down the road if needed. Joe, your hand is up.
Hi, thanks. So I have a few thoughts. I guess I have several thoughts. I actually wrote down what I had thought I was going to say before the meeting, and I discarded that completely, which no surprise there. First off, huge thanks to everybody, first off, that's spoken today. And secondly, everybody that stuck it out this far. I think this is a really important conversation. I've had a lot of conversations with folks about their thoughts on the mandate, their thoughts on Maine EMS's role. And I appreciate as much as anybody the concern about EMS workforce, which we see every single day, the system being stretched more and more. And I don't think that's going to get better with or without this. Whether or not this exacerbates it, I suppose is to be seen. I also, at the same time, I try to get my information from people that I trust and respect, and try to avoid, information even from government entities, from cable news. I'm proud to be off of Facebook for quite a while. It's helped me be a healthier person. But what I see is conflicting priorities. I requested some data from the EMS office, and I was stricken that we do have data that shows we've had 98 clinicians that, while positive, have cared for over 1,000 patients. I think that's important. I think that we know that a layered approach is important, and I think that both morally, ethically, and also by statute, we have an obligation to take steps to protect the public health. And that includes especially those that are immunocompromised, those that can't themselves be protected by nature of not being able to get the vaccine, for example. And oftentimes the patients we're caring for are traumatized in one way or another. So I think vaccination is the right thing to do. Balanced against the workforce issues, I do think that the draft rule does strike a nice balance. I think one of the pieces we have to remember is that the CDC rule is the CDC rule. It's not a Maine EMS rule. And we're going to exist within the confines of that rule, regardless of our feelings or opinions. What I would also add is that the CDC, just like our rulemaking process, will, if they intend to make this permanent, go into formal rulemaking, at which time there is opportunity for public comment, just as if we make this a permanent rule or wish to, we go to the formal rulemaking process with public comment. I do think, again, that this strikes a nice balance. There was a lot of misunderstanding, I think, or conflation of the two pieces in what I've heard today. What we have in our rule, which in my opinion establishes the guardrails for enforcement, if you will. It does include identifying those giving direct patient care to those that care for folks for more than 15 minutes and are within 6 feet of the patient, which, I know some people express concerns about groups like their billing agencies and things like that. It does at this point include emergency medical dispatchers. And as I hear folks that are talking about 40 to 50% vaccination rates in some of their agencies, I do think it's worth noting the concern that an unvaccinated exposure leads to 10 to 14 days of quarantine and could also effectively remove an entire center or service's ability to function. The rule that's proposed here as written requires proof of receiving the vaccine by October 1st, which is an important nuance. It does give a little bit of extra time. Again, something that we could think about or talk about today. And then finally, if you look at the end, when it talks about Maine EMS's role in enforcement, the language here is the failure to comply with the provisions of this chapter could be considered a violation of standards of professional conduct. And I would assume we would approach this as we do any other rule or statute that applies to EMS, and take every case individually if it was presented to us, look at the facts, look at the circumstances, and measure all those against what our obligations are. Somebody had mentioned the requirement for September 1st. I believe the intent of that is to start to gain information on the percentage of vaccination rates within the services ahead of the requirement. So I think that was misinterpreted by an individual to mean that's when everybody has to be fully vaccinated. So with that, I say I do support the draft rule as written. I'm certainly open to discussion, but I also would add that without creating our own context and without creating our own guardrails through a rule, we open ourselves up to more opportunity for this to be legislated on our behalf, and B, it creates higher levels of confusion on what our path forward would be in the context of a complaint. So my opinion is that we should adopt the draft rule, potentially with some modifications. Thank you.
Thank you, Joe. Any other thoughts from the board?
This is Heidi.
Heidi, go ahead.
I have many thoughts. However, the brief thought right now is that we adopt this rule, but add an extended period of time, maybe possibly till the end of October for the proof of vaccine or otherwise. From what I heard from these 79 individuals, or some of them, is that there's not enough time regarding this mandate.
Okay. But Heidi, just to back up a little bit, as far as the draft rule, that's something maybe modifying, but sounds plausible to you?
Yes, the draft rule that was sent to our board.
Okay.
Correct.
Yep.
Yeah.
Chair Libby, this is Steve.
Steve, go ahead.
I have to echo what Joe said. I think, we could take a look at that draft, maybe in a little bit finer details and change some of the dates like Heidi said. But I do think, one person said it earlier, the Swiss cheese model, the more we do to protect our patients and ourselves, the better off we're going to be, and maybe end this pandemic sooner. I think of one story that I heard this weekend while I was giving a vaccine to a patient who would not go into his doctor's office because he found out that the MAs were not vaccinated. He can't wait for October 1st because he can actually go see his doctor. And he's immunocompromised, has cancer, was able to get to that vaccine. But regardless, our patients don't get that option, right? They don't, if we're going to pick up the immunocompromised patient or anything like that, they don't have an option for a vaccinated versus unvaccinated crew. They can't just wait. They're in an emergency situation. And I think we need to take that into consideration as providers. Now, stop there.
Okay. Laura?
I do agree with what everyone is saying. However, I am very, very concerned about what will happen in the dispatch centers when this goes through. Like everyone has said, in all the testimony and everything and all the public comments, we're already at very critical staffing levels, and it's hard to keep people in the dispatch chairs as it is. And if people do decide to leave and these jobs are open, and as you saw, there's quite a number of people who are unvaccinated. When they leave, that's a key step in the entire EMS system. This goes through, we're gonna see a drop. I'm afraid we're gonna see a drop, and that's just gonna set things in motion for a lot more issues in the system. I'm also on the other side of, I feel much more comfortable when my coworkers are vaccinated because I know they're not bringing, there's that less chance they're bringing something into the center and taking us all out. So as we heard today, there's a lot of emotions, but it's a tough call all the way around. So just wanted to get that out there, and hopefully we can take that into consideration as well, because it is a very short time period and it takes a minimum of 6 months to get a dispatcher back in the chair. So if we lose any dispatchers, it's not going to recover quickly.
Amy, you're next.
Yeah, I was just going to make a comment on the dispatch part of it. I know we say in 3, it's direct patient contact, 6 feet, more than 15 minutes. And, like we've heard from dispatch centers, they're not direct patient contact. So not sure if maybe we can, I agree with Joe with taking out a whole dispatch center with someone positive, but if they're doing the masking coming in or, extra cautious, they're not direct patient contact. So maybe moving them down into the 3 instead of having them under 2 for definition.
Okay. Tim?
Thank you. Like Joe, I thought that there was a path forward with this before we heard testimony. And albeit some of it was anecdotal, I suppose some of it could be termed as, it's a veiled threat that people are going to walk. But when you hear so many people talk of their personal stories, their personal contacts about people leaving, our system is so fragile. At any given point, I mean, this particular mandate has only highlighted just how fragile our system is. And I think the comments from Eric and some other people about funding and others are all important. And our staffing shortages is a conversation for another day. But I can't support this emergency rule because I feel like it's a roll of the dice, and that we pass this and see what happens. And I'm concerned about what is going to happen. We've heard follow the science. Well, science told us masking, universal masking, N95s, full PPE, and it worked. We have heard from and it's our constituents that talk today. And I think we have to be careful about putting our own personal thoughts about what we think should happen versus what we're hearing from the community we serve. Sorry, my lights are on a timer. And they're saying they want alternatives. They're saying we need more time. We've worked for 18 months with PPE, and yes, people have gotten sick. Some people have had to quarantine. That's still going to be the case with a vaccine. And I'm not saying vaccines are wrong. I'm vaccinated. I support them. But I'm sincerely worried about our system. And I think if we do an emergency rule, then we first need to answer many of the questions that were asked today. Those need to be addressed and somehow incorporated into that emergency rule. I'd also like to see us send a resolution to the CDC to say, here's what your mandate has done. And I think there's a lot of confusion about what we can do as the EMS board. I mean, I know Ron tried to address some of this as an EMS board versus what the CDC and the governor's mandate says, and which one supersedes the other. And I know there are questions that people raised today about people who work remotely and are not even in the building, yet they work for an EMS agency. And if they're not vaccinated, you're in violation of somebody's rule. If this were emergency rule is all we have to work with, then I'm a no.
This is Heidi again.
Hold on 1 second, Heidi.
Okay,
I got
sorry.
Brad and then Rich, then you.
Sorry.
No problem. Brad, go ahead.
Yes, like anything else with data, I think we need to be very careful as a board to take the 80 or so comments that we heard today as gospel. I know me personally, with every fire chief that reached out to me the last week or so, I had another fire chief or director in direct opposition of that, to include what the Maine fire chiefs pushed out. There were a lot of angry fire chiefs that had no say in that letter that was pushed out. So I do know, again, on the flip side, yes, we heard from 80 or so folks, but we have 5,600 providers out there that we represent. And it doesn't mean that the 11% or so that were attended this meeting the feeling is out there. Because again, in my experience, I've heard direct opposition of what was said today with both vaccinated and unvaccinated folks. But I think we just need to be cognizant of that and realize that there is a bigger picture of this involved, and trying to make this umbrella encompass the staffing shortages that we have directly related to this. Again, most of these departments, or some of these departments had staffing issues prior to this, and I think they're trying to lump in their staffing issues into the pandemic and the vaccinations, which might necessarily not be the key. Are we going to lose folks? Possibly, but I don't know if this would be a mass exodus as everybody feels. So again, that's just something for us to consider as we move forward with this is again, we have to be very careful on what stance we take. So thank you, Chief.
Thanks, Brad. Rich.
Thank you, Chair Libby. I'm really confused. I actually came in here with some predetermined thoughts as well, just like the other two speakers had spoken of, but I am really confused as to what to do. But what I am not confused about is I am not going to support this emergency draft rule. My issue, this information was presented to me as a board member about 4 hours before I left for a 10-day vacation. Of that, 4 of those days I've spent so far dealing with this issue, whether it's at the employer or with the EMS board. And I don't have any information that says this is even a problem. Leading up to this, I haven't heard from the state staff that we are having infections being transmitted in the field, or that I have not seen I can't honestly answer Chief Robitaille's question, but I don't think that we have dealt with any mask mandate issues since the first beginning of that issue. I will not support this emergency draft rule for that reason, and I think that this is a problem looking for a solution. And I'm really concerned at how this all came to be. I'm not against the vaccine. I'm not against the mandate. I really just think that this was rushed through, and I feel a little bit frustrated that this board was placed in this position. And luckily, there was some good information that got out to some of our folks saying, "Hey, this board we had nothing to do with putting this rule into place." Most of us, I can only speak for myself, but I was not involved in any discussions at the board level that allowed this to move forward. So I do agree with Tim Beals that I would also like to do a resolution. That's the direction I'm steering to the CDC, and making sure that they're well aware, because it's clear to me that people were not aware of how our system works or how fragile it really is by putting this out there. Thank you, Chair.
Thank you, Rich. Heidi.
Oh, thank you. I was thinking about what Tim Beals had said about the masking. It's not enough. We're wearing masks at work. We're wearing them. The EMS providers are wearing them. They're putting them on our patients. We're wearing them at the hospital. It's not enough. The problem is, it appears as though people in the public have forgotten that we're still dealing with a pandemic. We're not wearing masks outside of the workplace. Therefore, we are probably transmitting it in that way or in that capacity. That is my concern for having either one or the other. We need both still. And if we're not wearing masks outside the workplace, then we need this vaccine.
Thanks, Heidi. Dr. Martell.
Thanks, Chairman. I just wanted to add a little bit of additional information from the scientific side. We've heard a lot of opinions. I think we all agree that there are concerns, and we certainly all agree that this is not necessarily fully our purview. This, came to us from CDC, DHHS, from the governor's office. I just want to make it clear, I think, for the greater audience, this isn't something that we were crafting. What we haven't talked about is some of the concerns and questions about the vaccine itself. And although I still think probably the vast majority of those questions are best suited in direction toward CDC, I think we can just make a few comments about efficacy. So there's a lot of discussion, between people, between agencies, between media outlets over what is the role of a vaccine. So there really is no vaccine on earth for the most part that is 100% effective. And, the flu vaccines that we have on a seasonal basis, they may range as low as 30%, they may go up to 60, 70%. The goal is not 0% transmission. And that's a very, very uncommon expectation. So the key here is decreasing the rate of transmission and the severity of disease. And so what we have seen is that there is a pretty notable decrease in the rate of transmission, although not zero, but it was never expected to be zero. And then there's a much larger decrease in the severity of disease. So there was a reference to one of the weekly morbidity and mortality reports from the federal CDC about the outbreak in Provincetown, Massachusetts, how there was a very high rate of vaccination. They did have an outbreak. It was a very dense kind of summer population that was largely unmasked in restaurants and bars, et cetera. So yes, there was an outbreak, but no, there was really not much in the way of severe disease. And so what we're really looking at here is how do we decrease the burden on the system? So this is almost a little bit like thinking about combat deaths versus combat injuries. So we may say, looking at a 15, 20-year period, a certain, number of folks died on the battlefield, maybe 3,000 or 4,000. What we're not seeing in that kind of a data set is maybe the 2 or 3 million that were gravely injured, to the point of never recovering the lives they had before. And I think that's part of the missing piece that we often aren't discussing here, is if we're decreasing transmission and we're greatly decreasing the actual severity of the disease, we're decreasing all of us that are providing care on this frontline basis. We're decreasing our risk, decreasing our family's risk, the community's risk, the patient's risk, and then ultimately also decreasing the entire burden to the system. For anybody that has been providing transport to Maine Med over the last 3 weeks, I think all of you probably are familiar with what it looks like to have a hospital with multiple outbreak areas and people in every possible corner, and sort of have a system that almost feels paralyzed. The goal is to decrease that burden. And part of the way that we decrease that burden on the system is to protect ourselves and protect our patients. So I guess my take home is just not that it's the same to have been infected, versus have a vaccine. The idea here is decreasing the rate of transmission and the severity of disease. Thank you.
Thank you, Dr. Martel. Any other comments, motions, recommendations from the board?
Chairman Levy, this is Joe.
Joe?
I do wonder if there would be value to receiving some legal advice on the risks and benefits of the approaches forward by the AAG. Curious how the rest of the board feels, but I'd like to understand the risks and benefits associated with each of our options.
I would agree.
Okay, I'm sorry, go ahead, Chair.
I was going to say, I think that's probably best done in executive session, Ron, as you indicated earlier. So I would entertain a motion to enter an executive session to consult with the AAG's office.
Motion.
Motion by Dennis and a second
Second.
by Amy. And Nate Allen.
Yes.
Tim Beals.
Yes.
Brad Chicoine.
Yes.
Joe Conley.
Oh, yeah, yes.
Heidi Cody.
Yes.
Laura Downing.
Yes.
Amy Drinkwater.
Yes.
Judy Garish.
Yes.
Joe Kellner.
Yes.
Rich Kindle.
Yes.
I'm a yes. Dr. Martel.
Yes.
And Julie on Tango. I have a message from Julie as a yes. She's by phone. Dennis Russell.
Yes.
Steve Smith.
Yes.
And Scott Susie.
Yes.
Okay. Ron, did you have something before we
Yeah, before we go into executive session, I want to make it clear to the board members and to the public that we'll be prepared to give you advice on your rights and responsibilities as the board, but we will not discuss any matters such as the rule in particular or text in executive session. So with that, I'll wait to go into executive session.
Thank you, sir. Jason, can you move us into a?
Yeah, so what I'm going to do is I'm going to open a breakout room and I will assign the board members to that breakout room as well as Hugh Johnson and Brown and Gay. I see Andrew Block is here. Would it be should we bring Andrew Block in there as well? Ron?
Yes.
Okay.
Who is that?
That's
He's the-
that's another attorney.
Okay. So folks that are watching, we're going to go into an executive session for hopefully a short period of time, and we will return back to this room as soon as we're done with that and resume the public meeting. Thank you. Dr. Martell, are you back? Gotcha. And Brad just popped back on and Joe Conley's back on. Okay. Everybody's back from executive session and bio break. I think I'm off mute. Yes. Okay. So we will resume any discussion, motions, or thoughts on the topic.
Chair Libby, this is Joe.
Joe, go ahead.
So I want to thank the AAG for the legal advice that we received as the board. I do think that we need to consider our ability to enforce any complaints that come before us, and I think it's only fair for those services that are governed by our rules to know the guardrails under which we'll be operating. Appreciating all the comments that were made, I continue to have dire concern about the workforce, and as such, I think it's important that this rule that we put forth, if it's agreed to, be appropriately narrow in scope, and also in responding to a good number of the concerns we heard, give adequate time for implementation. I do just want to convene my understanding, and I believe this to be accurate, that what we do today has no impact one way or another on the existence of the CDC rule, and continue to encourage those that are out there that may have concerns about that to make comment to the Maine CDC and DHHS as they go through their rulemaking process. With all of that said, I make a motion that we adopt the draft rule, Chapter 20, with the following changes. Amend the effective date of the rule to be August the 23rd through November the 21st, which should cover a 90-day time span. Remove from Section 2, Number 2, emergency medical dispatchers. Amend Section 2, Number 2 to read October 15th through November 21st, giving an additional 15 days for entities to have received proof of vaccination, which would require full vaccination no later than October 29th for all individuals. In addition, my motion would include a resolution that the board send its request to Maine CDC and DHHS to consider involving Maine EMS stakeholders in the review of their formal rule as they go through the rulemaking process. However, at a minimum, limit the scope to include those that participate in direct patient care as defined in our rule, which states individuals caring for patients within 6 feet or less for 15 minutes or more at any given time.
Your motion is heard. Is there a second?
I'll second that, Chair, Dr. Martell.
Okay. Any discussion?
This is Julie.
Julie, did you have something?
I just wanted to say I think that's a very reasonable accommodation to be made. Thank you.
Okay. Tim?
Yeah, two questions regarding the draft rule. One, just curious where the 6 years of maintaining records comes from. The other is there were several questions earlier about the Binax Now testing, and I'm just curious about 3 times a week. I know services were given the Binax Now test. I don't know if those are still usable, or are we looking at it? Those are questions I just, we were given this. I don't know where this data came from, so I'm asking for clarification.
Ron, go ahead.
So I can speak to one of them. The 6-year requirement was originally in the CDC rule. And it's not something that I think in drafting we picked up or flagged. In the context, this is a limited COVID rule. I believe the original DHHS rule existed for all immunizations. So there may be some policy consideration in their 6-year timeframe that they had adopted in that context. So just to be clear, that's something that in drafting was an artifact of the larger comprehensive immunization rule.
And Sam, can you speak to the Binax question?
Yeah, so serial Binax Now testing has been a part of our playbook for a while now. It's not necessarily been recommended because we don't know the accuracy of it identifying COVID-19 in people who don't have symptoms. The EUA for Binax Now was done under the idea that it's within the first 5 days of symptoms where a person's viral load are at highest peaks. So that's the original use of the Binax Nows. There have been some cases where they have been used to do serial testing, and this has been done in hospitals and other things. The risk that that poses is that with serial testing, you could have false positives. So you could have people who don't actually have COVID-19, but the test produces a positive. Within EMS, what happens with that is that person is now out of service for 10 days. And so that's why we were not recommending the serial testing, because you could have people that are taken out of service, and we were trying to protect the EMS workforce. So that's the reason why we got to this point. However, this is a very limited use of the serial testing platform, and doing it every 3 days would do so to make sure that those individuals who do have medical exemptions, we are screening them readily to make sure that they do not have COVID-19, particularly the Delta variant, which has typically a rapid onset of symptomology. And so you may not have that slow onset where you see it. So someone may get sick really quickly, but they may be infectious during that period. So the CDC's recommendation is, I think that they're offering for some facilities is twice a week. We put 3 times a week in here just because we want to make sure that we have a mechanism to do that testing and to do it readily. And so that was the intention behind that, is that we are seeing some of the Delta variant cases, they're having rapid onset of symptomology within the first 1 to 2 days following infection, whereas it was previously with the Alpha version variant, we were seeing it take 5 to 7 days. So we want to make sure we catch it before we're too far in. That's the intention there.
Tim, does that answer your questions? Any modifications as such?
I just question the 6 years. I mean, this is a 90-day rule and we're going to maintain records for 6 years. I don't know what would be a more appropriate, if the wording could be, records maintained to the end of the public health emergency or something to that effect. I don't know what the board's flavor would be. Or
the only counter I might have to that is that if to some of the questions that were asked of long-term, if long-term issues were to come up, then at least they could ensure that we had records that they had received the vaccine if they may have lost them, where they wouldn't be necessarily getting them through a PCP. Just a thought. Scott?
Thank you, Chair Libby. I agree that we need to do something. I think there's a whole lot of work that needs to be done to this draft. I'm agreeing with Joe with kicking it out, but I think the date ought to be January 1st. I think there ought to be an out for people that if you're not going to be vaccinated, that it'll be your choice not to do that, but you have to wear a mask 24/7 within the house on every call, and it has to be a TB mask. Testing if symptomatic, because there's no mechanism for doing it every 3 days. That's an unrealistic ask of anybody, because COVID isn't recognized already by what's going to happen with workers' comp. Workers' comp isn't recognizing exposures. Workers' comp isn't recognizing exposure on the job. So there's no mechanism for that. We already work within a fractured system. I think it's very fragile as a system right now. And to say that we're not going to take into considerations people's religious beliefs for a vaccine that's only been out for a year and a half. And I'm not an anti-vaxxer. I'm vaccinated. My whole house is vaccinated. My wife works within the medical system. I'm all for it. I also served in the military, and I'm all for what people's rights are. So I have a hard time doing this, but I see what's out there for the greater good as well on both sides of this coin. But at the end of the day, people have to want to get it to do it. And we can't do the backfill. If we pass this as is, even with some of the modifications, the repercussion from projected responses that aren't going to be covered will fall as well. So that'll be something else the EMS board will have to look at, or some calls just aren't going to get answered. There's just not going to be that staffing there. So I think this is a really big decision, and I think we ought to do as much as we can to keep this as narrow as we can.
So Scott, do you have some specific?
Yes, I think the date ought to be January 1st. If we're going to mandate it, I think we need to take out things that don't have direct patient care. So I don't think the call centers need to be involved into this, or the training centers. That's up. The schools have their own list of what they're doing. I don't think every 3 days is even feasible. So that would be section 3, number 4. I don't even think that's feasible because we don't even have the Bionex test. The documentation, we keep records anyways. And I think under an exemption should not just be medical, it should be religious, because there are a lot of people out there with different religions that this does affect. And I think we ought to look at that as a whole. And then if you don't want it, I think that should be your right too. But you have to mask, TB mask but we have to provide an out for those people that just absolutely aren't going to get it, but they're also going to have to wear a TB mask around the station and on every call.
Okay. Rich?
Thank you, Chair Libby. I am not going to support this resolution. Or I'm sorry, not the resolution. Sorry for the term. I'm not going to support this this motion simply because I still say that we don't have enough information. I really hope everybody's watching us, and I really hope that everybody understands the implications of jumping on board. I know that the train has already left the station. There's not a lot we're going to be able to do about the DHHS rule, but just like I'm not going to be forced into a vaccine, which I am already vaccinated, or I wouldn't want the people that work for us be forced into vaccinations. I'm not going to be forced into voting for something simply because somebody stepped first and forced us into this situation. I'm really concerned about the system. I don't truly believe in the mass exodus that everybody's talking about. Certainly could happen, but I really think that the voices today were heard loud and clear, and I am truly concerned for some of those rural places that talked about their stories about, 5 people leaving their service is going to really cause some havoc. And I completely agree with Professor Wellman's comments about the staffing is an issue that's happened before this. It's not a symptom of COVID. It's just exacerbated by it. I am really concerned how we even got here as a board to have to be forced into this. And I certainly don't want to do this today, but I certainly want to find out how we got here in the future and find out why we're in this position today to do this. So I will not be supporting it.
Thank you, Rich. Joe?
Yeah, a few things, some responses, and then another point of remiss not to mention before. I go back to the purpose of my motion. I tend to agree this feels fast, and there's a lot of information still needed. At the same time, the CDC and DHHS rule, at least for the next 80 or so days, is what it is. And I think that we have in our power to take an enforcement position that is narrower. And I think we have an obligation to take that more narrow enforcement position to be the minimum necessary mandate. Absent doing something today, the only professional standard we have is that which the CDC has put forward. So that dramatically broadens what we might be looking at to enforce. And I think that by doing this with our draft rule, we again set the upper and lower limit on what Maine EMS is able to or is looking to enforce. Again, recognizing that we cannot change the CDC and DHHS rule. So that rule does include EMS agencies, contractors, et cetera. That is what it is at this point. Noting, my resolution request to make our comments heard by them. But within what we can do, I think we have an ability to narrow the scope, and I think because of that, we should do that. And I think we should make it clear that within this rule, it says we may consider a violation of this, a violation of a professional standard. It gives us enforcement discretion, and I think that's important. And we can look at things in the context of a bigger picture. A couple of other pieces. I would like Sam or somebody from the office to speak to the availability of the Buy Next Now tests. I don't want to set anybody up for failure. I think that's important to make sure that they're going to be available for testing of folks that aren't vaccinated. I think Tim's point about records retention is certainly a reasonable one. I would consider amending the motion to be retain the records until 1 year following employment, or 6 years, whichever is greater. And I would also note that if this rule does expire, then that would go away. If this rule expires without becoming permanent, that would go away. There were some folks that spoke, and this is the part that I mentioned being remiss for not mentioning before, and I want to address those folks directly that were voicing medical concerns. There were a couple of different points that were made, and we did also receive, the board received a heartfelt letter from a clinician that I certainly appreciated with some real medical concerns. I think our rule is appropriately broad in what can be considered a medical exemption. It simply states that, I'm paraphrasing, a letter from a physician or mid-level saying vaccine is inadvisable would stand as far as our enforcement jurisdiction. The other piece is that there was another individual who spoke about an upcoming leave of absence due to a pregnancy. Congratulations to that individual, by the way. And I think it's important to underscore that if that individual is not working, they wouldn't be required to vaccinate as our rules written. So again, kind of looping back to the beginning, I think we owe it to folks to make it clear on what we can and cannot enforce. And I think we owe it to folks to make it as narrow as we possibly can. Hence my motion. Thank you.
Backing up to Joe's adjustment to retain records for 1 year and following employment of 6 years. Dr. Martell is the second. Are you okay with that?
Yes, I'm okay.
Okay. And Sam, do we know the availability of the Binex now?
I'm reaching out to Sally Weiss, who handles them right now.
Okay, thank you. Heidi?
Brent, one more point in amending the motion. I did make an error initially. I suggested removing emergency medical dispatchers. I cited the wrong section. I just want it clear that I'm referring to section 1, number 2, not section 2, number 2. Apologies for that.
Okay. Heidi, go ahead.
I just want to make a point on Rich Kinlan's point that I understand and respect that he doesn't support this, but we can't do nothing. So as a board, I think we have to do something to support everybody here, and obviously everybody knows supporting our patients and our the employees and everything. I just don't think we can't just let this go and talk about it at a different time. We have to do something today. That's all.
Thank you, Heidi. Brad?
So if this resolution is voted through, that's on the table now.
Draft rule.
Draft rule, yep, the draft rule. If that goes through as stated and outlined right now, as written, what is Maine EMS going to do for those leaders in the organizations that refuse to comply or won't follow up with obtaining the records or even enforcing it? How that?
And Ron can clarify for me if I misspeak, but it's my understanding that it would be a rule. And if it's found to be a violation of the rule, then it would go through the investigations process like any other discovered violation of the rule, of any rule.
Yeah, if I may briefly weigh in here. It's not a violation of the rule unless the board finds a violation of the rule. So what you would have, as the chair has indicated, a complaint would be developed and investigated, and that information would be given to the board for later for you to make the decision directly on that specific case.
Thank you.
Okay. Scott?
Sorry. Thank you, Chair. We're talking all these rules and whether we want to investigate individual licenses, and I agree with Heidi. We have to do something. But we're not, DHHS rule doesn't look at, they're not looking at the licenses. They're looking at the facilities. I have to go back and say that, just like they're doing for hospitals and clinics, they're looking at facilities. So it may not even come to EMS board when DHHS goes around. It's a facility. So if people aren't vaccinated by the date that we're putting down, even if that's valid, because this is as clear as mud. So if they're not vaccinated by the October 1st deadline, if we go ahead and adopt this, then as a service, we have to terminate those individuals. So it's not a matter of investigating whether we approve it or not. We're setting a hard date. They're in the facility. We're gonna have to terminate that individual, or whoever has those individuals is gonna have to terminate them. So it's nothing to do with investigations. It has to do with people losing their jobs over personal convictions. So that's my whole thing. If we're gonna set a set of guidelines, and that's a set of guidelines that we're gonna set as a board, that we're gonna comply back to DHHS, say this is what we're gonna use as a standard. So I think we have to either give people plenty of time or an option, one or the other.
Rich?
Thank you, Chair. And I agree. I appreciate Heidi's comment. I agree that we do definitely need to do something, but I might be a little naive and completely misunderstanding what's going on here. But the rule is made, and to Chief Susi's point, the rule is made. It's going to be DHHS is going to choose to enforce it at their level, however they choose to do that. I thought one of our options was the resolution, which has been put in this motion as well, to either identify our concerns or what our suggestions are for the final rulemaking piece of this. It's been very clear to me through hundreds of emails and this conversation today that we are stuck with this rule right now through DHHS, and I don't know what else we can do by being forced into taking their rule and adjusting it and keeping the mandate. We've heard loud and clear that the mandate is, in my opinion, the mandate is a concern for a lot of people. There are definitely others that are out there that are not as concerned for it or think it's a little less of a concern. But I think the resolution, I know there's a motion on the table, but my thought was going to be the resolution to to CDC and DHHS, because we cannot change this train's tracks. It's going, it's moving, and let them deal with it when the complaints come in. It's not our rule.
Joe?
Yeah, I appreciate that. And I really appreciate Chief Susi's comments as well. You know, I think it's really, really easy to conflate the two situations. And what I want to avoid as much as possible is creating more confusion than already exists, because there's a lot of it. Where I'm still stuck, for lack of a better word, is that, again, the CDC rule is the CDC rule that applies to every agency represented here. You know, we can debate whether or not it's, you know, well written, applicable. That's, I don't think, something for us to determine today. But I think we have an opportunity, and I'm looking at this, I think, a bit differently than perhaps some of my colleagues. I think we have an opportunity to make a statement on what our enforcement position is going to be. And here's a scenario that I anticipate could happen. So that scenario is CDC refers to our office a violation of their rule. We have no rule in place. We have no guidance that sets our enforcement parameters, our scope, etc. And absent that, we're looking at everything. What we're doing today, in my opinion, is making a statement that we are limiting that enforcement to the folks that it is most applicable to, and those are the folks that are routinely providing direct patient care. I think it's a disservice to not set those guidelines. And Chief Susi referred to pushing the date out. I certainly appreciate that as well. I'm not even certain we could do that to pick a date beyond the emergency rule date. I think, we're effectively giving till the end of October. I think that's a generous increase, in my opinion, of the enforcement timeline. And I think pulling out from our enforcement discretion, though I see a lot of risk in doing this, but pulling out emergency medical dispatch centers, responds loud and clear to one of the other challenges we heard. So anyway, my 2 cents, and for now I'll keep the motion as it is, just stating that I think it would be a disservice not to be clear about the scope of our enforcement and narrowing that appropriately. Thank you.
Any other comment or discussion on the motion?
Chair, can we review that? Sorry to be that guy, Joe, but can we review that motion?
Yes, please.
Disappointed y'all didn't write it down. I learned my lesson a long time ago and I wrote it down. My motion is to adopt a draft rule as written with the following changes. Amending the effective dates to be August the 23rd through November the 21st, covering the 90-day span. And I understand from talking to the AHE that an emergency rule has to commence on the date it's passed. Removing emergency medical dispatchers from section 1, number 2, amending section 2, number 2 to read October 15th through November 21st. Again, just a footnote there that extends the timeline for full vaccination to be October the 29th. The employer just has to have proof of receiving both doses of the mRNA vaccine or the single dose of the J&J vaccine by October 15th. Change the records retention to be 6 years or 1 year following employment, whichever is less. And then further passing a resolution that requests DHHS and the Maine CDC to actively involve Maine EMS stakeholders in the review of the formal rule as they go through the rulemaking process. At a minimum, consider limiting the scope to include those that participate in direct patient care for 15 minutes or more within 6 feet or less from any patient we care for. Thank you.
Thank you, Joe.
Any other discussion? I will offer that, in my opinion, I think the rule, again, as Joe pointed out, provides us some guardrails on either side. I don't like it any more than anybody else does, but I think this addresses a good many of the questions that we heard today. And if nothing else, provides a better level of guidance. This is still an emergency rule, so it still has further refining that will need to be done before it becomes, a final rule. Certainly doesn't take some of that issue of choice away from people, and I sympathize with that and I agree with that. But also from an employer standpoint, we need some sort of boundary, because we can't string people along for weeks and months and hope that nobody knocks on the door. I don't think that's fair to them, and I don't think that that's fair to our communities and the citizens that we serve. So I think we need to narrow it down and at least know what those bumpers are going to be for the next few weeks, so that we can try and move forward from this, and people can make educated decisions on all fronts. Ron, go ahead, please.
Just a technical comment. In terms of effective date, it'll be when it's filed with the Secretary of State. There may be a day or two process delay because we need to get someone in our office to do the form and review. So the way rulemaking works is the Office of Attorney, after you pass it, someone in my office, it can't be Katie or I or another one of our colleagues who worked on this rule, will have to actually sign off on it's called a MAPA 1. So just in terms of expectations, it may be a day or two delay. The other thing I want to just note is you need to also adopt a basis statement. And I did circulate a basis statement, so you can do it concurrent with adopting the rule. It's better if you do that concurrent with the rule or prior to the rule. And the basis statement gives, essentially, as it implies, the basis for the rulemaking. But also, most important in this matter is that the findings of an emergency. So again, I would just ask that you consider the basis statement as well. Thank you.
To that point, have folks seen the basis statement and the findings of an emergency? And if not, would you like me to read it?
I was just going to request that it be read for the folks on the phone as well.
Okay. So the basis statement as submitted, 32 MRS section 81-A states that the purpose of EMS laws to provide for a comprehensive and effective emergency medical services system to ensure optimum patient care. Under that law, the provision of medical assistance in an emergency is deemed a matter of vital concern affecting the health, safety, and welfare of the public. 32 MRS section 84-1A requires that the Board of Emergency Medical Services the board adopt forms, rules, procedures, testing requirements, policies, and records appropriate to carry out the purposes, requirements, and goals of this law. The Maine Department of Health and Human Services, Maine, the department declared a public health emergency effective as of July 1st, 2021. After that declaration, on August 12th, 2021, the department adopted an emergency rule that requires certain entities, including EMS services, to require its employees to be immunized against COVID-19. The board finds, based on the findings of the department, that requiring certain EMS providers to be vaccinated against COVID-19 is necessary to protect the health and safety of the patients, as well as to provide force protection of its providers in order to maintain an effective emergency medical services system during this public health emergency. Findings of emergency. The board further finds, based on the present existence of a declared public health emergency, that the immediate adoption of the proposed rule is necessary to avoid an immediate threat to public health, safety, or general welfare. Specifically, the board finds that the expedient adoption of a vaccination requirement for its licensees is necessary to avoid an immediate public health threat pertaining to the transmission of COVID-19 amongst the EMS system and its patients.
Chairman Libby, this is Joe. I'll amend my motion to include the basis statement as read.
John Martello, you all set as the second?
Yeah, I'll second that.
Okay. Any other discussion before calling the vote?
Brian, it's Tim.
Tim, go ahead.
I just, because so many people talked about it today, and again, in the emails that I've received, is there any, is the board willing to consider an alternative to, in addition to encouraging the vaccines, to, as Chief Susie mentioned, 100% masking with N95 and testing, as other states have done, as an alternative to the vaccine?
Joe Kellner, your motion.
I appreciate Tim's position, and I appreciate that suggestion, but at this point, I'm going to keep my motion as is.
Okay. Scott?
Sorry, I heard it a couple times. Joe, could you clarify? My bad, because it was a couple times. Are EMDs involved in this?
No, my suggestion, Scott, is to pull EMDs out of it, and I included that in my motion.
I heard it. I'm sorry.
No
My fault.
apologies. It's all good.
Judy, did you have something?
No, I'm sorry, I'm all set.
Okay. Any other comment or discussion on the motion? Sam, go ahead.
Regarding the records retention, those standards were pulled from the original rule, and those may be Bureau of Labor Standard and OSHA recommendations or requirements for the retention of those records. It might be better to just defer to Bureau of Labor Standards regarding records retention. I don't know if we can make reference easier than just including it. Just something to consider. I would hate for our rule to be in conflict of yet another rule, so that people feel like they're in compliance by following ours and they're out of compliance with another. Ron?
Okay, yeah, I'm sorry, Chair, would you like me to address that?
Sure, go ahead.
It's infinitely more difficult to incorporate by reference. You would have to print out the Bureau of Labor Standards and then incorporate it with this into the with the submission of the rules. So to the extent you're looking for an expedient adoption, do you have a copy of the specific rule at hand, Sam?
I do not.
The incorporation by reference has to be specific to the publication, and also it has to be provided to the Secretary of State at the time of adoption.
The Secretary of State also has rules on record retention already in place. So
Could I suggest, and Ron, curious on your opinion, that we just remain silent and remove that last sentence in section 4, number 1?
I'm not going to give policy advice, but as I've indicated, it was an artifact of the original rule and not something that was conscientiously placed in there.
Yeah, very, very good. So I again want to avoid putting people in a bad spot. As such, I will once again amend the motion to remove the last sentence in section 4, number 1, remaining silent on records retention.
Dr. Martelli, you all set with that?
All set.
Okay. Last call. Okay, roll call vote on the motion. Is
Chair,
everybody else set? Go ahead.
Chair Libby.
Yes.
Sorry, I just have, I have one thing. I wouldn't be doing a service to what we do if I didn't ask one more time for an amendment for a workaround for either masking and testing for people that are that set against it. From all the 70 something comments we heard today to just the flood of emails that we got from last Thursday to today, there needs, I believe that we should provide some sort of option to the people that we serve. And I don't think I'd be doing my seat right for any services out there if I didn't ask for amendment for a workaround. If we're gonna give something to DHHS, I think we ought to have our input on the rule as well. I wouldn't be able to support not having a workaround in what we have. Does it personally affect? It kind of does, because the EMS world and the fire world is truly been my family for 16 years. I believe we need to provide a workaround for our family. And that's all I have. Thank you.
Brent, Tim?
Let me just check with Joe on
Yeah.
the requested amendment.
Well, it will save you checking twice.
Oh, okay, go ahead, Tim. Thank you.
I'm just going to echo Scott's comments. This is a temporary rule, so we're basically granting a temporary workaround in addition to encouraging the vaccine. And at the end of the day, if it's if the final rule includes vaccination, then it does. But at least we've given as much, I think, workaround as possible in a short time frame, so that we can avoid some of the system strains that we've heard today. That's my last plea for that workaround.
Thank you, Tim. Joe?
Give me a minute. Let me defer to Rich and then.
Okay.
Thank you very much, Joe. And I would be able to shift my support to something that contained a workaround. I really am. I feel that's the right thing for us to do as a board, is to support our system. I just think it's the right thing to do. And I would be able to shift my support if we had some sort of workaround.
Okay. Heidi, then Dennis.
I just don't understand how the masking is any different than what we have been doing now. I'm just not seeing that piece of it. We're already doing that, and we're seeing that it's either not enough or not working. I can see people shaking their heads, and I'm really interested in why.
Rich?
I think Dennis was before me, certainly.
Go ahead, Rich.
I guess, Heidi, for me, I haven't seen that it isn't working. I don't have any numbers that says that clinicians are getting infected, and I'm simply talking about EMS. I don't know about the other facilities that are involved in this, but I haven't seen the numbers that say we just met a month ago and there was no talk about elevated numbers or concerns with PPE or different things that we were doing. That's really the basis of my decision on that. I don't know that there is a number that says we're not doing it right.
Dennis?
I agree with Rich. I just haven't seen those numbers in the EMS side, but I do want to throw out that I do support Chief Susie and Tim with figuring out something a little bit different in order to support this motion.
Dr. Martell?
I just want to add that as of today, the Department of Defense is mandating the vaccine. So I think we need to think about, sort of this idea of autonomy versus federal and state, overreach. We're at a point where our armed forces are going to be vaccinated. So I just think we need to sort of consider the gravity of the situation. I'm with Heidi. If masks were working, then we would not be having in-hospital outbreaks. We certainly wouldn't be having several of the surges that we're having. We can sort of debate all day long numbers and whether there's data specific to individual regions or services. But the reality is, for those of us that are on the hospital side, we're seeing a very, very large rise in cases, to the point of it causing a near paralysis within the hospital system. So there is, make no mistake, there is a significant burden of disease. That's all I have.
Okay. Steve?
Just have a couple clarifying questions. So we're talking, within 6 feet of patient care. What does this do for training centers? I know what the colleges have done so far, but I meant I'm thinking like Tri-County or United, or what does it do for their training centers? Does it exclude them unless they're going to be in patient care? So like a student, maybe if they're going to go to clinicals. And then the other one would be with this testing with the Binax. Now I know we're still waiting on an answer for that, but even if there was testing, I assume it would be the service that's responsible for that, for paying for any kind of testing.
It would, as I read it, I think you're accurate on the, if the student is within direct patient care, then they would be required to have it.
But the educators and or office staff probably would not, because they're not going to be with direct patient care.
That is how I would interpret it as it currently sits, yes.
Brent, could I add a footnote to that?
Please.
So again, we got to double down on this point that the CDC rule as written still stands. And my interpretation of the CDC DHHS rule, again, this is Joe's interpretation, is that it would include all of those people. What I'm suggesting through my motion is we limit our enforcement scope to, as it relates to training centers, only including students that are providing patient care. So it, again, dramatically limits the enforcement scope as much as I feel is appropriate.
All set, Steve?
Yeah, I think so.
Okay. Brad?
Ms. Heidi, I'd like to address your concern. What you are missing in this equation, being a hospital-based provider, is, correct me if I'm wrong, Sam, back in May or so, maybe June, the guidance had changed a little bit at the state level, and it more or less was left up to the services to enforce the masking around the station. So me, for example, I could work for one department and not have to wear a mask around the station because I was vaccinated, but then I'd go work in another department where I had to mask regardless. So unlike the nursing or the hospital world, you guys kind of maintain the status where masks to all of this. There was a period of time over the last couple of months where that was, the enforcement at the administration level was laxed at these places. So we kind of got a taste of what it was like to work in kind of a quasi-norm atmosphere. And now we're trying to, quite literally put the horse back in the barn. So I think you'll find that's where some of this is coming from, is that unlike you, we actually may or may not have been wearing the masks as diligently as you guys in questions that we're having to deal with now. So I just want to make sure you didn't have your question unanswered, but that's kind of where that history.
I definitely did not know that. Thank you.
You bet.
Ron?
I'm just putting out as an option. My colleague and I are doing our best to track these various changes. If an option, and I know the board would like to deal with this probably sooner than later, is if we could have a 10-minute consult, my colleague and I, we could actually provide text to make sure we've captured all of the amendments. You've had quite a few amendments at this point. So that's up to the board and up to you, how you would like to proceed before the vote.
Okay.
Otherwise, we can do our best, but we would advise, we don't think it would take that long. Just give us a shot to incorporate the amendments as we understand them.
Okay. I'll get back to you on that one. Amy, go ahead.
I'm just saying that also with the masking, we were talking about if you're unvaccinated, Chief Susie was saying to have, the N95s, not just a regular surgical mask. So that would be the option. So I'm a little agreement on that. So that we have that option out there for the people on the calls today.
Joe, circle back to you.
Yeah, I've been digesting. I think what I'd be willing to say at this point, I'm not prepared to change my recommendation on the draft rule, and certainly we can hash that out through a vote if and when we come to that. What I would suggest is in the resolution to request that DHHS and CDC look at potential alternatives as part of their evaluation on the need or efficacy of this rule on their part. But following what appears to be the absolute best practice and best way to protect our patients and our workforce, I continue to maintain that vaccination should be required absent a medical exemption. And as such, I'll keep that the same. However, amend the resolution to request that CDC and DHHS take alternatives into account as they assess their future permanent rule.
Do you feel comfortable to vote, or do you want Ron and colleagues to loop it all in?
Chair,
Yes, Dennis.
I think we should vote to see if this is gonna move through as proposed. I'd hate to take a 10-minute break and have them rework everything and it not pass.
Okay. Whatever passes is what the language is, though. So
True. We should then. I'll leave that up to you, Chair.
Sam, you have a question?
Joe made a change to his original motion. So do you need to have Dr. Martell reaffirm his second for that?
Yes, thank you. Dr. Martello, you all set with that revision to the resolution?
Yeah, that's affirmed.
Okay. And Joe, for intents of review, could you run through your motion as it finally stands, and we'll call the roll with no further discussion.
Yeah, would you allow me to ask a question of Sam first? I want to clear up the by next point to make sure that we have an answer on the ability for services to obtain these free of charge. Sam, have you had any luck with an answer to that question?
So I have reached out to Sally Weiss. She did respond that they were getting more delivered today, but I haven't gotten a final answer about the quantity that we may need or those answers. So I have not had a final answer about that. So when we originally went into this, we had conversations with CDC about them making sure that they could support the EMS community with Binexes. But again, this is a new ask, a new addition. So I believe we should confirm with them. We need to make sure we can confirm with them. Yeah, so the answer is no. I haven't received confirmation yet.
I want to make a change because of that, Brent, but I need a few seconds to write it out just to make sure that I articulate.
Brent, can I just weigh in on the Binax?
Yes, Tim, go ahead.
So Joe, when you're thinking about, so every 2 days means with some services schedules, people will be coming in on their off days to get tested. I don't know if there was a way to do it at the beginning of their shift, or I understand Sam's point that the variant shows up more quickly, symptoms develop more quickly, but it also means that people are gonna be coming and going from the station more often. With it, I mean, they don't work 5 days a week, usually, especially if they're on a 24 schedule.
Chair,
Yes, sir.
and the thing with the Bionex, they only, it's not practical. They only work if you're symptomatic. So you can't just do them every 3 days as this is written. It has to be symptomatic in order to run the Bionex. So that's why I said in the original one that change the wording to symptomatic and not every 3 days, because there isn't a mechanism with that system.
Okay.
I'm not sure that's accurate. We currently use the Bionex at my work every day in the emergency department. I
Sam?
definitely could be wrong, but I'm just saying that is what we use every day at work right now.
Okay.
Yeah, just the guidance we got from the first time that we had them was not to be used unless symptomatic, unless they've changed their guidelines on them.
Sam, go ahead.
Yeah, so the EUA, the original EUA for the Binax Nows was for use with symptomatic patients. There has been off-label use with serial screenings, and that's what this was intended to do with serial screenings, because you would improve the accuracy of the test by doing over and over and over and over again. You would improve the accuracy and sensitivity of the test. So that was the idea behind that. If you use it on someone like today, don't have a cough, don't have a runny nose, don't have any symptoms, if you use it on me right now and say 4 days ago I was exposed, the likelihood of my viral load being high enough to be detectable is less likely than it would be if I had a high enough viral load where I was symptomatic. So that's the idea behind it. And because of the false positive rate, we wanted to avoid that from occurring. In the hospitals, if they have a positive Binax, I can't speak to what y'all are doing, Heidi, but I imagine you're probably doing a PCR test on those folks as well. If they have, are you doing PCR testing for all your patients that you admit? I see
For the
Dr.
patients,
Shaw.
yes, pardon me. I'm
Okay.
sorry if I was not clear. I was talking about the employees doing the Binax testing every day. So
Okay, but serial testing, right?
The Binax testing is being done on employees currently, every day that they show up to work.
Gotcha, for serial
Not every
testing.
2 days, not every 3 days, but every day that they show up to work. And then we have PCR testing in addition to that.
Gotcha. So you are doing serial testing. That's how you're doing it. Okay, that makes sense. Perfect.
Amy and then Joe.
Yeah, to what Tim said, and that we also have people that do not live where they work. They're an hour or 2 hours away. So to have them come in on their days off to do Binax. But I think it says here, if available for response to emergencies. So is that meant to be said when you go to work, you'll have to have that every 3 days? Or like, so if you're on your 5 days off, when you go to work, you get a test and then on off? I guess there's got to be more maybe clarity to that testing.
Okay. Joe, what'd you come up with? Muted.
Had to happen to somebody today. I'll give it a stab. So open for discussion, changing section 3, number 4 to read as follows. Contingent upon a service's ability to obtain Binax or antigen testing at no cost, a covered emergency medical services person with an exemption must receive a Binax Now test 3 times per week or at the start of each scheduled shift, whichever is less, if that person is available for response to emergency medical calls.
I think that covers it.
Yeah, I second that again.
Okay, Joe, can you give us the rundown on the entire motion?
So where I think we're at is recognizing the need to establish enforcement criteria and clarify for EMS agencies, as well as the need to adequately protect the public. My motion is to amend the draft rule as circulated and adopt it with an effective date of August 23rd through 11/21, removing emergency medical dispatcher from section 1, number 2, amending section 2, number 2 to read October 15th through November 21st, amending section 4, number 6 to allow destruction of records 1 year following termination of employment, amending section 4, number 6, correction. The last sentence is deleted in its entirety. So I take correction there. Amending section 4, number 6 to delete the last sentence in its entirety and remaining silent on records retention issues. Amending section 3, number 4 to read contingent upon a service's ability to obtain Binax or antigen testing at no cost, a covered emergency medical services person with an exemption must receive a Binax Now test 3 times per week or at the start of each scheduled shift, whichever is less, if that person is available for response to emergency medical calls. I further move that the department create a resolution requesting that DHHS and the Maine CDC actively involve Maine EMS stakeholders in the review of the formal rule, at a minimum, considering limiting the scope to include those that participate in direct patient care for 15 minutes or more and within 6 feet or less, and considering alternatives to vaccination for those that may have or need on exemption.
Dr. Martell, does that hold steady with your second?
Yeah, that's a second.
Okay. Ron, quickly?
Yes, I just want to be clear, Joe, did you, again, we're trying to follow this. So under your amendment, you took dispatchers out. Are training centers licensed by the board still covered entities or only students who are providing direct patient care?
I believe it's adequate as written where it talks about students providing direct patient care considers a part of this rule. So I'm not suggesting incorporating training centers and their staff.
Okay, so to be clear, students who provide direct patient care are covered. Students that do not are not.
Correct.
Thank you.
We'll call the roll. Nate Allen,
No.
Tim Beal,
No.
Raj Cohen,
Yes.
Joe Conley,
Yes.
Heidi Cody,
Yes.
Laura Downing,
Yes.
Amy Drinkwater,
No.
Judy Garish,
Yes.
Joe Kellner,
Yes.
Rich Kinlan,
No.
I am a vote of no. Dr. Martell,
Yes.
Julian Tango,
Yes.
Dennis Russell,
No.
Steve Smith,
Yes.
and Scott Susie.
No.
That's 7 no and 9 yes. Motion carries. Ron, did you have a question or is that just a residual?
It's just a residual hand. I guess I haven't figured out how to turn it off. Thank you.
Okay, thank you. Any other items for the board today?
Brandon, Tim.
Tim?
Should we reconsider the rule we I'm not sure it was a rule, but guidance that allowed a service to respond at a lower level if need be? can't remember the exact wording or how that, but there was a point in time where we allowed services to respond at a lower level due to staffing concerns during COVID. Should we be prepared for that?
Yes.
Is that something that we can bring up in our next board meeting?
We can. I think the only thing we'll need to check is if that had an expiration. And I know that we passed it. I just don't know how long it lasted.
I think it's expired. It's expired at this point.
I mean, we could probably wait till September, but we should put it on the agenda.
Agreed.
Brent, this is Joe.
Go ahead, Joe.
Just an informal request to the office. The first reporting due on the percentage of vaccination of each agency, I believe, is due September the 1st. So I'd like to have that available for review at our September board meeting to establish the baseline of where we're at.
Okay. Anything else from the group?
Brent, real quick.
Yes.
Yeah,
ahead.
just regardless of where you land on this, how you voted or where you're at in the audience, a lot of hard work in front of the general public and in executive session. So I just throw out a real quick, well done and greatly appreciated. And thank you very much.
Thank you, Commissioner. Anybody else?
Chair Rich,
Rich, go ahead.
I'd offer a motion to adjourn.
Is there a second?
Second.
And Joe, correct me if I'm wrong, we need a roll call for that too.
In practice, we haven't taken one for motion to adjourn. We just do it by show of hands if you're concerned.
Those in favor of a motion to adjourn, show of hands, please. Very good. Motion carries. Thank you all for your time today, both public and board members. Thank you. Meeting is adjourned.
Thank you.
Oh, hello.